Okay, welcome to the regular board meeting for San Mateo County Board of Supervisors for Tuesday, February 26th. Will you all join me in the Pledge of Allegiance?
Of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Supervisor Pine?
Here.
Supervisor Groom?
Present.
Supervisor Slocum? Sorry. Here. Supervisor Tissier? Here. President Horsley?
Here. Okay, now is time for public comment. That's for items that are not on the regular agenda. And the first speaker, actually you have 3 cards for Marty Fox. But do the first one.
Good morning, Mr. President, honorable members of the board, my fellow veteran Supervisor Slocum. Thank you for your service. And thank you, Ms. Jensen and Mr. Byers. Laura's Law creates an effective treatment compliance behavioral situation, as the United States Department of Justice certification reflects. Experienced speakers avoid using exaggeration because they understand that using hyperbole risks admitting the relative weakness of their own case. If their audience misspotting hyperbole the first time, the audience will reject the inexperienced speaker's proposal when they discover that using hyperbole is an implicit insult and a waste of time. Forced treatment procedures are authorized by the Lanterman-Petrus Short Act and the Penal Code, but not Laura's Law. The exaggerations used to describe Laura's Law are an admission that the case against its implementation is at best weak. The exaggerations used to describe Laura's Law display contempt for the intelligence of others and a disrespectful use of their time. I wish to thank those who have, in effect, admitted the case for implementing Laura's Law is based on strong evidence of its effectiveness and efficiency before the Board of Supervisors Standing Committee meeting in this room on October 18th, 2011, and again in their February 5th memorandum to the board. Please overlook their youth and inexperience, as I am sure they did not intend to make an issue of my age or more than 40 years of experience. More parents and family members who refuse to give up on adult children living with mental illness, complicated by a lack of insight into their need for treatment, will be injured or died until providing mental health treatment before a crisis becomes routine, regardless of whether the affected individual volunteers for it. Laura's Law can create an effective treatment compliance behavioral situation here in San Mateo County as soon as you plan to vote to implement it. Thank you.
Thank you, Martin. Next, we need to set the agenda and to approve the consent agenda. Any items to remove from the consent agenda?
I'd like to remove item 19 concerning
Okay, any other items? Anything else to remove, or what I'd like to do, actually, if we're about to set the agenda, I'd like to move item 6. It's actually on the regular agenda, and if the board concurs, when Mr. Maltby returns, we will work with him to determine when that item should be brought back to the Board of Supervisors.
With those 2 changes, I'll move approval. Set the agenda and approve the rest of the consent items.
All in favor? Aye. Okay. The agenda is now set. First item is a presentation on the Winter Spare the Air program by the Bay Area Air Quality Management District. Supervisor Carol Groom.
Thank you, Supervisor. Fasano from the Air Quality Management District is not here at the moment, so would you mind if we did item number 2?
Oh, that'd be fine.
Okay.
Item number 2 is the Bay Area Quality Management District's San Mateo County Employers Great Race Trophy presentation. And again, Supervisor Carol Groom.
Thank you. This is the Great Race for Clean Air is sponsored by the Bay Area Air Quality Management District, and San Mateo has participated in this event for a number of years. So the Great Race is a 2-month competition between Bay Area employers to see who can reduce the most carbon dioxide by promoting commute alternatives instead of driving alone. So during the months of September and October, 1,200 employees from 93 Bay Area companies logged their daily air-friendly commutes. Approximately 674 tons of CO2 were saved by the employees who chose not to drive to work alone. So San Mateo County has 2 winners, and they're being recognized for the highest CO2 savings. And CO2 savings are calculated based on the length of the employees' commute, their vehicle's gas mileage, and the number of miles that were traveling using one of the commute alternatives. So I'd also like to recognize Stephanie Anderson, who manages the Great Race for us in San Mateo County, as well as John Ford, who's the Executive Director of the Peninsula Congestion Alliance. And now I'd like to introduce the winners. Gilead Sciences, accepting the trophy, is Vivian Slacer, Walter Russo, and Andrea Duker. They saved 168,668 pounds.
Everyone's gonna want one next year, once they see what this trophy looks like. You're all gonna be in. Oh, my word. It's heavier than an Oscar, my goodness.
Not bad, yeah.
And our second winner is from Facebook, and this is Jessica Herrera, Juliana Hoyos, and Monica Wong, and they saved 146,310 pounds of CO2.
Oh, sure.
Bad this morning, that's why we need the Great Race and these commute alternatives, everybody was stuck in traffic. So Gilead Sciences.
Yeah, amazing, huh? Amazing technology stuff. Oops, gotta get the box.
And hopefully next year we will have larger contingent from San Mateo County participate.
Okay.
So President Horsley. She's on her way in now. Item 1 is on their way in. So,
In that case, why don't we go to matters set for a specified time?
okay,
And we can come back to that
excellent.
later. So
Thank you.
the first one is the acting as the governing board of County Service Area Number 8, which is North Fair Oaks. We have a public hearing to adopt the resolution, and Mr. Porter is here to discuss that.
Thank you, President Horsley, members of the board, Ms. Jensen, and Mr. Byers. We have a brief PowerPoint presentation that I'll go through, and then I'll answer any questions. The department is before you today to ask for an increase in the garbage collection rates in County Service Area Number 8, which is North Fair Oaks. I hope you remember this map. This is a map of all of the franchised areas within the South Bayside Waste Management Authority area. The North Fair Oaks area is item number 7, or area number 7, that's listed on the chart and is over near 101. It's essentially our largest unincorporated franchised garbage area. And this area has historically been franchised and operating under SBWMA for several years. As I mentioned, we are a member of the SBWMA. They're one of 12 agencies. the way that the SBWMA operates is there is a garbage collection contractor who is Recology, who actually goes out and picks up the garbage. And then there's another contractor, South Bay Recycling, which operates the transfer station and the MRF, the Materials Recovery Facility. So when the garbage is dumped off, they sort through the recyclables and then also essentially process the solid waste and take that up to the landfill. They do all the hauling up to the landfill. Each year, those two contractors submit a rate application in accordance with the terms of the franchise agreements that they have entered into with the various jurisdictions. Recology's compensation, the collection contractor, is tied to several factors, one of which is labor. The other is the time it takes to collect that refuse. They have onboard software which allows them to very closely track the time they're out in the field and the number of lifts they're making. And they are also allowed annual adjustments that are tied to various indices like Consumer Price Index for areas in the compensation application. SBR is a little bit different. They're allowed adjustments, but they're tied to other indices, and those are, for instance, the cost to dispose of the material up at the landfill is one of them. They also pay the city of San Carlos a franchise fee for being allowed to operate in the city. The way that this franchise agreement is set up is that over the first 3 years, both contractors are allowed to adjust their costs so that they can understand what their actual operating costs are, because at year 4, which will be next year, they will go into more of an indexed allowance for cost increases. So their adjustments will be tied to a series of indexes, but I think the best way to think about it is it's fairly closely tied to Consumer Price Index. So any major swings in costs will need to be absorbed by the different agencies, or there would need to be a modification or amendment to the franchise agreements. Each year, as I mentioned, these agencies submit rate reports. And I just went through this, but the way the contract works, as I said, is they're allowed to adjust their costs over time. But this is a very key year because this will be the last time that they essentially get to true up. When these rate reports were submitted this year, the initial rate report that we received showed that North Fair Oak should have a 9/10 actual rate reduction. We thought that was somewhat curious in that the rates had been held flat the prior year. So we hired an independent consultant to go through these rate reports in tremendous detail. As a result of that work and working with the SBWMA, we found that the correct adjustment for North Fair Oaks should be 4.8%. And the reason for that is when we looked into the rates in detail, we found that certain accounts weren't assigned to proper jurisdictions, and some of the costs weren't assigned to proper cost categories. For instance, there were Redwood City accounts that were being charged to the North Fair Oaks area or being accounted to that area. And what that means is we were receiving revenue from these people when we shouldn't have been receiving it. So when everything is taken out and adjusted properly to account for the proper accounts in the proper jurisdictions, it yielded a 4.8% rate adjustment. We dove down into that even deeper. We looked at commercial accounts versus residential accounts, and we found that the cost adjustments were primarily attributed to costs of collecting residential waste. So when we made our recommendation to your board, our recommendation provides for a 6.1% increase for residential collection and a 2.6% increase for commercial collection. When we implement those adjustments, we will have adequate revenues to meet the projected expenditures for next year. This table is somewhat complicated. It's the table that I showed you last time for the county franchised area with the North Fair Oaks figures in it. But basically what that tells you is the top line is the revenues that we'll be collecting. The bottom line is the expenditures that are projected for the next year, and the bottom line is the deficit. So when you add up all those factors, we need to make up about $105,000, and we're doing that through the rate adjustments that we're recommending to your board. This slide provides some comparison of where North Fair Oaks is projected to be relative to other cities, and you'll see that we are on the lower end of garbage rates for this SBWMA franchised area. In terms of protests, we're having a Prop 218 protest hearing today. We've received 4 protests to date. There are 3,217 accounts in the North Fair Oaks area. In order for there to be a successful protest, we would need to have received 1,609 protests. But as I mentioned, we've received 4 to date. And in terms of the increase that we're proposing for residential customers amounts to $1.51 per month per customer for the minimum service, which is actually 64 gallons. And with that, I'd like to answer any questions you might have in this regard.
Any questions?
Thank you, Mr. Porter. I did meet with staff and had a number of questions on this item, and I just wanted to thank staff and you for your work in drilling down and getting those accounts flushed out. Just one question. I saw an item on one of your slides called incentive payment at $26,000.
Yes.
And I was wondering if you could just talk about that for a moment. What is that incentive?
There are several incentive payments that are allowed under the contract. One is an exceptionally high amount of diversion from the contractor. Another is a reduced level of complaint calls. And during the contract year last year, if you add up all the total incentives and disincentives, the North Fair Oaks share of that for the contractor was $26,000 for both contractors. So it provides the contractor an incentive to provide exceptional customer service as well as increase the diversion numbers.
Thank you.
Any other questions?
I'll move to close the public hearing.
Move second.
Second.
All in favor?
Aye.
Aye. Okay.
I'll
Now,
move to adopt the resolution.
second.
Second.
All in favor?
Aye.
Yes.
Aye. Okay. Adopted. Thank you very much. Next is the Human Services Director's. Person here?
Yeah.
Oh, let's go back, I'm sorry, go back to one.
Thank you very much. It's now my pleasure to introduce to you all Lisa Fasano, who is the Director of Communications for the Bay Area Air Quality Management District. And I asked her to come today to give a presentation on the Spare the Air program for the winter, because I know it's can be annoying to people, and we get a lot of calls and a lot of emails, and so this really is for the good health of all of our residents, and I thought that Lisa could do a much better job of explaining it than I can. So thank you for being here, Lisa.
Thank you, Supervisor Groom. Good morning, President Horsley and members of the County Board of Supervisors. I am Lisa Fasano. I'm the Communications Director for the Bay Area Air Quality Management District, and the Winter Spare the Air program is actually coming to a close shortly at the end of this week. It runs through the end of February, but I am going to tell you a little bit about the program and how we think it's making a difference here. So, just by way of background, the Bay Area Air Quality Management District is the government agency that regulates stationary sources of air pollution within the 9-county region of the Bay Area. Stationary sources include factories, industrial sources, refineries and power plants, dry cleaners, backup diesel generators, and stationary diesel agricultural engines, just to name a few. Basically, any stationary air pollution source that has an emissions stack is something that the Air District regulates. The Air District is also required to ensure the region complies with state and federal air quality standards, including ozone or smog, carbon monoxide, sulfur dioxide, nitrogen dioxide, and particulate matter, both large particles, PM10, and very fine particles, PM2.5. But PM2.5, or fine particulate matter, is the particles that we're addressing through the Winter Spare the Air program. PM2.5 consists of millions of microscopic particles that can easily bypass the body's natural filters and penetrate deep into your lungs and enter the bloodstream. Here you can see that in the Bay Area, wood smoke is the largest source of wintertime air pollution that we face. PM2.5 is very tiny. If you think about a single hair from your head, the average human hair is about 70 micrometers in diameter, making it 30 times larger than the largest fine particle. So these are undetectable to the human eye, but they're very tiny. We breathe them deep into our lungs. The size of the particle is directly linked to their potential for causing health problems. Small particles that are less than 10 micrometers in diameter pose the greatest health threat because they can get deep into your lungs, and that some may even get into your bloodstream and can complicate other organs and systems. Fine particles are the leading cause of health risk from air pollution in the Bay Area, accounting for more than 90% of premature death related to air pollution. Health impacts include aggravated asthma, respiratory problems, heart disease, stroke, and potentially premature death. People with heart or lung disease, children, and older adults are the most likely to be affected by particle pollution exposure. However, even if you are healthy, you may experience temporary symptoms from exposure to elevated levels of particle pollution, and that impact is going to be immediate. So even if you aren't someone who suffers from asthma or another respiratory condition, you can feel a dryness or a tightness in your throat immediately. Exposure to wood smoke pollution is linked to increased frequency and severity of respiratory illness, such as asthma, bronchitis, lung disease, and cardiovascular disease. And wood smoke is especially harmful for children, the elderly, and those with, as I mentioned, respiratory conditions. Because of the serious and immediate health effects of particle pollution during the winter from wood smoke, the Air District adopted the wood smoke regulation in 2008. And the rule prohibits burning when high particle pollution is forecast to build up in the region. From this slide, you can see that the health benefits of reducing 1% of air pollution in the Bay Area has huge benefits for the huge health cost benefits for the region when we can just reduce a small amount. And as you can see there, just from wood burning alone, we can save $39 million from health-related costs if we can reduce particle pollution. So the wood smoke rule was adopted, and there are additional requirements when burning is, or when particle pollution is forecast to be high. We prohibit burning wood in fireplaces, outdoor fire pits, and in even EPA-approved burning devices. It also prohibits excess smoke and burning garbage year-round. And there are requirements on the installation of less polluting wood-burning devices when people come up for new construction or remodels. And the winter spare the air season runs November through February, as I mentioned. So why does wood smoke pollution build up in the Bay Area? Well, in the winter months, weather conditions change where we often get very cold, still days and nights that last for several days. This occurs due to the development of an inversion layer. It's warm air aloft, compressing cold air below, and that basically sandwiches the wood smoke or the particle pollution in the area that's within our breathing zone, around our houses and in our neighborhoods. Pardon me. The cold and still winter weather can trap smoke pollution close to the ground, where it can build up to extremely unhealthy levels. When this occurs, the Air District issues a winter spare the air alert to protect public health throughout the region. So during the winter months, November through February, we require the public to check before they burn. The Air District has several ways that the public may check or be notified that a winter spare the air alert is in effect. It is posted on the Bay Area District website, which is baaqmd.gov. Residents, governments, and businesses can download our Spare the Air widget, which is that little box there on the left-hand side, upper left-hand side, to post to their websites. The widget will automatically change when a winter spare the air alert is in effect. I believe you have it on your San Mateo County website. Residents and businesses can also sign up for automatic email alerts by going to sparetheair.org. They can call the 1-877-4-NO-BURN line to hear the daily air quality forecast and to determine whether or not a Spare the Air Day is in effect. Or they can simply sign up for automatic phone alerts. That's where you put in your number and an automatic call comes back when we put a winter Spare the Air alert in effect. We have more than 13,000 people throughout the 9-county region that sign up for automatic phone alerts, and we have over 100,000 people who have signed up to receive email notifications. Pardon me. The Air District does a great deal of advertising and outreach to let the public know about the Winter Spare the Air program and the need to check before you burn. Outreach for the program includes advertising, media, social media, and outreach to the community and local governments. All advertising, media outreach, and social media are done to the community, and we work with local governments to reinforce the check before you burn message. Each effort will support all the others to reach more Bay Area residents with the Winter Spare the Air message. And this is a map that we show at the Air District annually to show all the areas where we have done outreach throughout the 9-county region. And if you can see here in San Mateo County along the coast, the little pink bicycle, that's Craig the bike guy. We send him out to farmers markets, walkable shopping districts, other outdoor festivals. We have in-theater movie theater ads, billboards. We put our messages on buses that drive up and around neighborhoods. We conduct door-to-door outreach where we select 4 or 5 cities in the season, and we go knocking on doors. We hand out the wood-burning brochure, which I brought a number of them here. They're on your back table. We give those to residents. We talk to them and do a brief survey with them. This year, in San Mateo County, we visited Pacifica and did door-to-door outreach there. So we do our level best to get the word out in as many different ways as possible to communicate to the public the impact of wood smoke and how harmful it is. And slowly we're seeing that the public is recognizing that it is in fact a harmful air pollutant. So this is what air quality looked like this winter. This is the entire winter season. And I know it looks like an echocardiogram, but this is actually what wood smoke looked like, or what particulate matter looked like throughout the Bay Area. This season, we had relatively moderate levels of particle pollution. We were fairly fortunate. During November and December, if you remember, we had a lot of winds and heavy rains, predominantly in December, and that helped reduce a lot of our wood smoke pollution. But come January, things dried out and it stayed dry for extended periods of time. So we had this very dry, still weather with little to no wind, and particle pollution began to build up. And it was during that period that we began to see very unhealthy levels throughout the region. This is specifically what January and February looked like. And the white dots on this chart are the days that we actually called a Winter Spare the Air alert. There were 10 alerts that were called this season overall. We saw that this was different from past seasons, the past seasons since we began the program in 2008. Because what we saw is when we made the call, the public actually reduced their burning, and we saw particulate levels go down. In past years, we would make the call and we would still see elevated levels and we would still see exceedances of the federal and state health standards. But in this year, when we made the call, we started to see those levels drop. People were not burning, and that was very good for all of us. It helped us to avoid unhealthy exceedances of the federal and state standard on all but one day this season. And as you can see, that actual date there is January 23rd. We made the call on the 22nd for the 23rd. We had a great deal of outcry on that particular day because we had light winds and very light rain. It was the first little bit of rain we had in January for some time, but it wasn't enough to knock down the level of particulate pollution that had already built up in the area. And so we actually called, but we exceeded the federal standard on that day. Since 2008, we have seen an overall 15% drop in wintertime particulate levels overall, and that's very good for all of us. We believe that this program is working, that the public is starting to recognize that wood smoke is the other secondhand smoke, and that Bay Area air quality is improving overall due to this program. And I'd be happy to take any questions at this time.
Any questions? Yes, Dave.
Thank you for your presentation. It's really, really helpful and very impressive. Yeah, I'd just be interested in hearing a little bit more about how the public, is thinking about emissions of wood smoke. I mean, you know, growing up, it would never have entered anybody's my mind that wood smoke was at all dangerous. And the fireplace is a very important thing to many people, and I imagine you must get a lot of pushback. So just get your sense for how public perception is on this matter.
Well, I'll be honest with you. It was difficult from the beginning because there was a perception of, you know, the warm hearth and sort of gathering around with the family by the fire. But what the federal government has begun to learn, and this has been recent, is that particle pollution is actually far more harmful than they once recognized. And there have been increasing studies, and there's a greater recognition that particle pollution is a very serious air pollutant. So what we're doing is trying to put that message out, let the public know, try to convey those studies, and then do what we can to reduce it. It really is the other secondhand smoke. You think about smoking in restaurants or smoking in outdoor eating areas. You know, it used to be 20 years ago, we had that all around us all the time. We didn't think much of it. They put the ban on smoking in restaurants, inside buildings, inside offices, and all of a sudden we started to recognize, wow, things are actually cleaner, and it actually does make a difference. And we're starting to get that level of recognition now with wood smoke. People are seeing that things seem cleaner in their neighborhoods, because that's the deal with wood smoke. We regulate pollution from a regional level, but if I'm burning a fireplace in my house and I live next door to you, I may not be impacting the region, but I'm certainly impacting you and your home. We also know that we've done some studies and measurements inside homes, and you can see as much as 15 to 20% of particle pollution can build up inside your home, as well as going out the stack. You can't see it, but you're getting those fine particles in your house. And in the winter months, when your doors and windows are all closed up because it's cold, you're just creating a very unhealthy indoor air environment. So as we put those messages out, the public is recognizing more that the need to curb particle pollution from wood burning and taking strides to reduce.
I think I have a lot of fine particles from the 60s and 70s. In New Hampshire, everyone had a wood stove, and you go into the house and you could barely see across the room.
Yeah, yeah. And it was the same with smoking. I remember, you know, you used to see that haze of smoke across people when people smoked in houses. Well, it's very similar with wood smoke. So.
Thank you.
Thanks for your presentation. It's really very helpful, very informative. And thanks.
Thank you, Lisa.
Thank you very much.
Okay, now it's the number 4 Director's Report for Human Services Director.
Mr. President, honorable members of the Board of Supervisors, Ms. Jensen, Mr. Byers, I wanted to give the HSA presentation today focusing around child welfare and some of the challenges that we face. When I had first moved to this county, I didn't know that we were, the 14th largest county in California. In fact, we're actually larger than 4 states, Alaska, North Dakota, Vermont, and Wyoming. And we have over 177,000 children in our particular county. That's our blue bar right there. San Francisco is just a little bit to the right, just to give you some reference. Even though we're a fairly large county, we have some of the lowest child welfare statistics in the state. We have the second lowest number of referrals in the state, the second lowest number of substantiated referrals, the 4th lowest in terms of entries into foster care, and the 4th lowest in terms of out-of-home placements. And why we've been so successful is that we've had the support from your board, as well as flexibility and that of the county manager's office to be able to address some of the issues faced by our children. We're also accredited at the national level, and we just got reaccredited. And we are only one of 3 public agencies that are accredited across the entire agency, not just with child welfare, but with many other aspects of the agency as well. If we were the 14th largest in terms of child welfare statistics, we'd actually be 3 times as large in terms of referrals, over 5.5 times as in terms of substantiated referrals, 5 times the number of entries into care, and 4 times the number of out-of-home cases. And unfortunately, we are picking up some statistics that are really concerning to us. In the past couple of years, we've actually seen a 12% increase in the number of open cases. And open cases are driven by the number of referrals that are coming in from the community. And if we looked at just referrals on families, we've actually seen a nearly 29% increase in the number of referrals about child maltreatment on families. And if we delve down into a little bit more about looking at referrals on children, we've actually seen over 55% increase in the number of referrals on children in terms of maltreatment. And we were trying to delve into and drill down into why we are seeing such a particular spike. This is year-to-year trends. As you can see across all of our particular areas, we're seeing an increase. Just one note about the differential response. The reason why we're seeing such a small increase in differential response was that we capped the number of slots that are available. So that was more of a reflection on the ceiling that we had put in place than the number of DR responses that we were sending over there. Month to month, from January of last year to January of this year, as you can see, we've had significant increases. Follow-up investigations, the decrease was not a reflection of a true decrease, but a reflection of how quickly they were moving cases through to the next stages. So one of the areas that we had posited was the possibility that it had to do with the economy and in relation to child abuse and neglect. There's a general theory out there that as the economy gets worse, there'll be more child abuse and neglect, and if the economy gets better, there'll be less child abuse and neglect. And this is a bit concerning because since 1948, at least nationally, there have been about 11 of these recessions. And if you looked at unemployment, there's always seems to be a spike of unemployment after each of the recessions. So if you believed in the theory, there would also be a spike in child maltreatment after each of these particular recessions as well. Looking back to 1990, 3 of these recessions nationally, California, higher unemployment rates, San Mateo, lower unemployment rates. But again, you see the spike of unemployment after the recessions, indicating that there would probably be a spike of child abuse and neglect. And if we look over an 8-year period from the beginning of January 2005 to 2012, this is our unemployment sort of rate. And what we would expect is that child maltreatment would fall right before the recession, would rise as the recession is kicking in place, and would fall again. This is our actual trend line in terms of open CPS cases. And if you looked into the statistics, what it's essentially saying is that there is almost a perfect inverse relationship between unemployment and open child protective services cases that is statistically significant. In fact, we could see for every 1% increase in unemployment, we drop by 47 cases, and for every 1% decrease in unemployment, we'd actually see a rise of 47 cases. And it's been near perfect for every month for over an 8-year period in that particular aspect. Now, we think that one of the areas is in relation to the self-sufficiency standard, but before I get into that, I need to talk a little bit about the federal poverty level. As you may know, the FPL is based on where the feds say that a family has enough money to buy food. And unfortunately, it doesn't vary by state, and if you can see in this next paragraph, well, you can't quite see it here, but a family of 3, federal poverty level is $19,000. And many of our federal benefits are actually tied to the federal poverty level. CalFresh, 130% of the FPL to be eligible. The WIC programs, 185%. School lunch and school breakfast programs, 130% for free meals and 185% for reduced meals. And in the 1990s, researchers said that, the FPL is really only one metric. We have to look at other things that are going on. What about the cost of housing, the cost of transportation, childcare, education, et cetera? and that it should vary from jurisdiction to jurisdiction, not just be the same across all the jurisdictions. And even if you look at the family composition, you should be able to have differences. And they set a standard where you can have up to 4 adults and up to 8 children in 4 age categories: infants, preschoolers, school-age children, and teenagers. And you can mix and match, and depending on what the composition is, it's a different self-sufficiency standard. So if we compared California and San Mateo, as I mentioned, the FPL is the same, 130% is the same, 185% is the same. And in California, the self-sufficiency standard is approximately $50,000. That means it's the amount that you would need to economically survive in this particular area. For San Mateo County, it's actually a bit larger, nearly $80,000. It's about 42% higher. This is the median here. So for that same family of 3, essentially you would potentially have this particular purple bar that's called the self-sufficiency gap. In essence, if you're in that particular gap, you do not make enough to economically survive, so to speak, but you make enough to disqualify you from federal benefits. So one of the things that areas that we had looked into as well is that, is there any evidence for that? Based on the census, from 2008, at the height of the recession, to 2011, more than 6,600 families here in our county fell into that particular gap, representing over 22,000 individuals. And our self-sufficiency gap has grown 9 times as large as California. So one aspect of why we're seeing this increased caseload, even with the better economy, is that people are getting better jobs, but they're not getting jobs with incomes that are exceeding the self-sufficiency standard, but it's enough to disqualify them from the basic safety nets that are out there. The second area that we actually looked into is the impact of the economy on mental health issues. And there's actually research out there that has shown that as the economy gets worse, there's adverse mental health outcomes for both adults and children. In fact, one study looked at mental health aspects for children, and they found that in a poor economy, even if you had high family status or strong parental educational background, it could not protect the family against adverse mental health issues for the children. Food insecurity was another research study that they looked into that said that if you're food insecure, you have higher chance of having basic mental health issues in children that are on the rise. There are some protective factors in that. And one of the protective factors that researchers had suggested was that there's really no relationship between unemployment and child mental health issues, because people are on unemployment benefits and other federal benefits that are out there. Research has shown that recessions lead to food insecurity, but a protective factor against that is being on SNAP, being on CalFresh as one of the protective factors. However, we have a few ironies that are going on here, at least in San Mateo County. We are the 33rd richest county in the U.S. out of 3,000 some counties out there. We have the 2nd lowest unemployment rate in the state, but we actually have the 57th lowest SNAP participation rate, CalFresh participation rate in the state. And the state, California, has the lowest participation rate in the nation. So even for those families who are eligible for CalFresh and that would have these protective factors, they're not utilizing them, so that they are much more vulnerable to mental health issues. Again, why the increasing in caseloads from the economy and mental health? If you think about it, there were around 25,000 children who were born around the time of the recession who are now entering our schools here in the county. And so you're having mandated reporters in the schools who are reporting more of these issues that they are seeing. And in fact, in 2011, AB 3632 funding, mental health funding, was shifted from the mental health agencies back to the schools. So many of the schools now are the de facto mental health agencies for many of these children, and they are reporting more potential child maltreatment issues in relation to mental health issues that they are seeing as well. Other possible issues, some ideas that were positive as to why. Maybe as more people are working, they're putting more children in childcare with mandated reporters so that they may be reporting. Maybe we've had some policy changes, protocol changes. About 4 years ago, we changed what our risk assessment approach was, at least within our particular county. And then we need to look at trends across different populations as well, and we're going to look into that. But just to give you a flavor, we actually did look at who were reporting maltreatment among children 4 to 6 years of age who were entering the school systems and around that time. And this is the ugly chart for that, and we cleaned it up a little bit. And what you see here is that one area, clinicians, you see the spike around the beginning of 2011 among mental health clinicians in terms of reporting children who were at school. These are daycare providers. Remember, one of the things that we had thought about, maybe it's daycare providers, but they're actually flatline and very low. So we don't think it's among the daycare providers reporting. These are school officials here in the red. And again, you see that spike around the beginning of the school year for 2011. And then this last line are other case managers and social workers. And what's interesting about this particular graph is that the spike that you see here, you don't see that at the California level if you look at their statistics. So they do show an increase, but there's not the spike that you suddenly see around the school year, as well as that. Other challenges that we face are staffing has gone down at the time that the economy had hit a few years ago, and in relation, our caseloads are going up. So we're trying to address that particular issue from our angle. State realignment prior to 2011, for every dollar that you spent on a federally eligible child, the feds would give us back 50 cents in return, and the state would give us 35 cents in return. After realignment, the feds would still give us 50 cents in return, but the state handed over the funds to us, and then we'd cover the other 50 cents. However, the state locked in funding at the 2009-2010 caseload levels. So as I mentioned, we're now higher than that. That means that we're now having to pay more net county costs to be able to cover these particular funds because the state has locked it in as part of realignment. The other aspect that is concerning, at least to us, that really we have no control over, none of us do in any of the counties, is something called the look-back provision. Remember, I had mentioned that if a case was federally eligible, then we can draw down federal funds. How a case is determined as federally eligible, meaning that the next child that walks into the door, is that child eligible for federal funding? The way that we determine that is that our staff look back to the 1996 federal poverty level tables and take 60% of that and determine that if a child today is eligible based on 1996 standards, then they are federally eligible. So that same family of three today can make no more than $7,788 to be federally eligible for us to draw down federal funds. What this is saying is that every year since 1996 and from now on, we have a harder and harder time trying to get our families eligible for that, which means more net county costs have to come out from us. Unfortunately, caseload trends, if we looked at California, 70% of the current open cases in California have seen decreasing caseloads still since 2009. And in fact, the California Department of Social Services is projecting another 8% decrease in caseloads for the coming year. Nationally, caseloads have decreased by 3% overall. So we don't have that leg to stand on to go back to either the state or the feds to say that, well, we're increasing. Unfortunately, the rest is not. They have, in some of the counties, including Los Angeles County, the largest county, seen an increase in the last 6 months, but the statistics are not catching up as quickly as ours. We started much earlier. What we have done, conveyed the issue to our partners, worked with personnel to ensure that we have a 0% vacancy, trying to do succession planning. As soon as we identify someone who's retiring or resigning, we try to move the process of trying to fill that position as quickly as possible. Strengthen our ability to use evidence-based data to drive decision-making. For example, we're going back to a 3-region model. These are our old zip codes that we have, the north, central, and southern region. But based on our current caseloads, what we saw was that a quarter of the children, or only a quarter of the children, would have come out of the central region, and about 40% of the children would have come out of the southern region. That means that if we equitably distributed our staff on the southern region would be hit hardest in terms of the number of cases that they see, and our staff in the central region would not be hit so hard. So if we redistributed the zip codes, this would mean that we'd have a little bit more equitable, not only staffing, but also in terms of cases that we would see in this particular area. What we also propose to do is, as I mentioned, regionalize CFS services, Children and Family Services, go after federal and local funding, including Measure A funds, create a more integrated services with our economic self-sufficiency and SMC works. Essentially right now, our eligibility staff only make a Medi-Cal eligibility of our children. We do not, at this particular point, at least within my division, have our staff looking at benefits for not only that child, but that entire family. What we're proposing to do is if that family is right there, we might as well look to the adults in that family and the entire family and say, are you on CalFresh? Do you have the benefits that are available to you, so that they're not having to walk out the door, so to speak. Re-examine how we do placements within San Mateo County, create a child welfare core practice model that is in line with state efforts. It's something that we wanted to do. Work towards caseload numbers that are consistent with our accreditation standards, as well as SB 2030, which about 10 years ago said that set certain caseload standards. Just to give you a flavor of that, our emergency response workers have about 22 children on their caseloads. The caseload standards set by SB 2030 is less than 10. Okay. And then wanted to work with Stanford as well as Berkeley to get us some of the data that is out there. Part of our goal is to develop a real-time, evidence-based, data-driven decision-making model for us that is fully supported by predictive analytics. And an example of that is that researchers in Berkeley took all births in California in 2002 and matched those records with child welfare records. They found that birth certificates actually had a certain number of risk factors. And if you had at least 3 of these risk factors, 15% of the population in California had these 3 risk factors that predicted 50% of all CPS exposure in the next 5 years. So if you can imagine, if we're able to take that information for us and say, a child that came into the system with these 3 risk factors, I have a 50-50 chance that that child will come to our attention within the next 5 years. We can send in preventative programs, not only on a geographic level, but also on an individual level, because we know who that family is, even based on birth certificates. So this example here, this is actually child maltreatment rates, but if you can imagine that we generated a map of high-risk areas such as Loma Mar, as well as 94063 in Redwood City, and we say, hey, these are the areas that will have a spike in child maltreatment within the next 5 years. We can align our staffing, we can align our training, we can work with our community partners to say, go in there right now. The system doesn't exist yet, either here or anywhere in the nation, and that's what we're proposing to do, is to set up a state-of-the-art prototype for this particular system. So in summary, first of all, we can no longer really look to trends in other places. We can't look to the national trends, to state trends, to see what is happening here in our county. And part of that means that we have to be able to use evidence-based data to help guide our particular decisions, and that we have to work to better integrate our data to get it on a real-time basis somehow, to draw down that information. And finally, this is not only a child welfare issue, but it's actually an issue that affects the rest of the community as well. For example, there's a lot of research out there that talks about the long-term effects of child abuse and neglect. And for example, foster children only make up 2 to 4% of all Medi-Cal enrollees, but they cost about 40% of the mental health funding for Medi-Cal in some states, of the entire Medi-Cal funding just for foster children. Okay. That's it. So if you have any questions?
Any questions?
I just have a quick one, and that was very sobering, I might add. Two questions. One, you were talking about the trends in 2012, or with the recession, how there were more child welfare cases. Now that we believe we're sort of coming off of that recession and coming into a better time, I know you've only had really a month of this year, almost 2 months. Have you seen any improvement at all, or do you even have those numbers yet?
We're still, in January, which is the first month for this year, we're seeing even higher rates than last year.
Oh, really? Okay.
So it's still spiking upwards.
I know you're using the fellows that are here from Code for America on the SNAP program, are basically trying to eliminate hunger in our county. Are they going to work at all on this issue as well, sort of tying in if someone is eligible for the SNAP program, basically, what other services they're likely to have, other services that they would be able to be eligible for? Are we looking to tie what they're doing into any of this?
They're working on a number of particular projects, and it's something that we're working with them on. A variation of what you just said is that schools are really pushing API scores, et cetera, and if 40% of their children are actually enrolled in free or reduced lunches, they are able to leverage Title I federal funding that will help all children in that particular school. And as part of the governor's budget, he had proposed that if 50% of the children are either limited English speaking or enrolled in free or reduced lunches, that school will receive an additional 35% in funding per eligible child. But it's something that we have to work with the schools to be able to say, your issue is our issue, because if you're able to leverage all that funding, it helps the entire school support better programs for your children, and it's likely that we'll see less child abuse, at least calls that are coming in from the schools.
Thank you.
Any other questions?
Any questions?
Supervisor Groom?
Go ahead.
Thank you. I'm curious about families that perhaps have moved because of housing costs and other reasons, so they've moved across the bay, or families that have just kind of given up on trying to get services. Have you come across a lot of that? Especially as I saw some of the statistics on the caseloads?
We have come across it in the sense that part of our responsibility is to actually look into some of the issues they face, including whether or not they moved here from another county or even from another state. So as part of that, we actually do ask them about, have you moved recently as well? And then we sort of check on that, work with the other jurisdictions to try to help them with whatever is going on in that.
I was actually thinking of the reverse, where they leave our county and because they can't afford to live here, or the sustainability of 80,000, that the gap there, so how many families do you think leave on a regular basis?
That part I don't have the statistics for, but in some situations, some families do not have the flexibility to leave their communities for a number of reasons. And that's why we have such variations across different zip codes in terms of income levels, et cetera.
Supervisor Pine?
Just a couple of questions, but first off, that was an excellent presentation, just terrific use of data. You certainly have really analyzed this in a lot of interesting ways, and I think it will help us in addressing the problems. Early on, when you were talking about the increase in referrals, you mentioned and I don't remember quite what the words were, that the referral slots, or some slots, are only gone up slightly because we're capacity restrained.
Yes, that's differential response.
Yeah, what is that, and why? And tell me more about the constraint.
There are many levels to this. When we investigate a child abuse or neglect case, in some instances we determine that we need to open up a child welfare case from our particular department. That's called Path 3 for differential response. There are actually two preceding paths, Path 1 and Path 2. Path 1 is when we say that, you know, there are some potential indicators of future exposure to child welfare services, but they don't need to come to our system yet. We can actually work with the community to refer the family to the community so that they can stabilize whatever issue there is. So that's path one. Path two differential response is when we say, well, it's a little bit higher level than that. We don't have to open up a formal case, but we will actually work with the community agency to try to address their particular need. So in terms of differential response, we allocate a certain number of slots that are available to them. And up to 2012 was the last contract cycle in which we had, based on prior numbers, we had set a particular number of slots that were available to them. Your board had actually approved an increase of a 50% capacity at the last board meeting for differential response, so that they should, at least on their particular end, address that. But what you're also sort of on a corollary issue is that it's not only differential response that will see an increase as well as our agency, but it'll also be other community agencies that work with us that will also see an increase in the number of issues and cases and whatnot. So we're trying to strategically work with them to say, if there's an increase on our end, we need to be able to give you the necessary funding so that you could support us in working with these particular families as well.
Okay, that's helpful. On the self-sufficiency standard, and you mentioned for a family of four, it's about $80,000, which, yeah, I think, you know, that would be tough. I mean, it's very expensive to live here and have two children and pay all the bills. But you also mentioned that the median family income was about $81,000. I mean, so, I mean, does that suggest that half of our families basically are struggling to live in San Mateo County?
Yes, almost half of them are potentially struggling. And it's a very high self-sufficiency, yes.
Yeah, I'll talk to you more about that offline. It's quite eye-opening. And then finally, could you just share your thoughts on, you know, why you think we've had such a hard time with the service uptake with CalFresh and SNAP, and you know, you said we're 57th, and do you think there's some unique things about our situation that contribute to that, or what's your current thinking on that?
I'd have to defer some of that to my colleagues in ESS. One of the areas that I've seen is the stigma associated around CalFresh. We've actually heard of some instances, for example, in schools in which there are actually two lines for lunches, one for children who are on free and reduced meals and one for children who are not on free and reduced meals. And that creates a stigma. Myself, some folks know that I was a former refugee, and many years ago my family was also on welfare, and many of my family members to this day refuse to acknowledge that aspect or even share that piece of information with folks. It's a very stigmatizing aspect, and part of the reason why we even changed the term to CalFresh away from food stamps was to get away from that from that overall context. And we're working with our community agencies to really do that, and we have some strategies to potentially address that.
Yeah, I mean, I can follow up offline. I would think that the stigma would be an issue, you know, in all communities. So again, I wonder if there's anything particularly unique that might explain our lower uptake. But again, I can talk about that more with others too. But thank you again for your very, very good presentation.
Dr. New, just a couple of quick questions. Actually, you glossed over Measure A funds pretty quickly. I noticed that. And I was really taken by the county manager's report. It showed the number of referrals had dramatically increased. I was really surprised at that. And so you've pretty much explained exactly why that's happened. In terms of, like, you know, school children having two separate lines, I can tell you that some of the schools that I have seen, especially like in North Fair Oaks, there aren't two separate lines. All of the kids are in either free or reduced meal. So
That's true.
The income level in some of our communities is appallingly low, and I just don't know how they do it, but somehow they manage to do it, and the kids are pretty resilient. One of the things you did talk about was risk factors being predictive of future coming into the system, and talking about working with Stanford and UC Berkeley, the alma mater of a couple of our board members. What do you really need to be able to? You talked about you haven't been able to get that system in place yet. What do you really need to be able to get that system in place? I know it's a measure of funds.
We need to be able to conceptually get to the point that we can leverage data. A lot of times people say they create, for example, they'll say, well, we're creating great data dashboards and we have information, et cetera. Much of the times the problem with data dashboards, which were really designed after car dashboards, a couple of major flaws in that. One is that really half the people don't understand even a car dashboard of the information that's on there. And secondly, it's not really predictive in terms of what it is. It can tell you in some of the really nice cars that you have 15 miles left on where you are, but it doesn't say where you'll be in 15 miles. And that's where we need to work with our researchers to be able to say, could you help us as an agency really leverage some of the information to be able to predict some of those things? And when I had asked Berkeley, the researchers about, could you give us the data for our particular county? And they said that, well, in the past, we're not allowed to do this because that was research and therefore. But they're working through the process of at least getting us our county data so that we can then leverage that data. And then another aspect will be that we'll set up opportunities, hopefully, to work with health systems, for example, to be able to say, hey, look, if a child is born and they're filling out birth certificate information, let's get that information over to us, and then we can send in teams. And health systems also has, for example, their home visiting program where they'll send in public health nurses into a home to provide prenatal care, to provide an extensive network of care to ensure that things like child abuse and neglect doesn't happen.
Okay. Again, thanks for your presentation, Dr. Nguyen. We have 3 speakers on this item. Sharon McAlevey.
Good morning, President Horsley, honorable board members. I'm Sharon McAlevey, AFSCME staff, representing a variety of workers in the Human Services Agency. I come before you today to speak about Child Protective Services. In 2008, there were substantial eliminations of support staff and social workers in Child Protective Services. As you've heard, the workload due to referrals of suspected child abuse has dramatically increased. These referrals need to be investigated, and as a result, many move forward into the system. At each step in the process, staff, inclusive of social workers and with supervisor oversight, diligently work on these cases and provide support and services to families. While we can debate the causes of this increase, the effect is that with the staff numbers such as they stand now, the workload is not manageable. So while identifying the causes of child abuse is important and working on prevention is also important, adequate staffing to deal with these incidents of suspected abuse is imperative. As workers' caseloads increase, workers' stress level rises, and their ability to deal with these cases may be diminished. Not only is this bad for the worker, but it is potentially unsafe for the clients as well. The best way these children can remain safe at this time is to increase staffing in Child Protective Services and the Family Resource Centers located in the schools. One of the points made during the Measure A campaign was that if passed, some of this money would be used to help keep children safe. Please maintain your commitment to these families and add funding to increase staff to help prevent abuse and keep children safe. Thank you.
Thanks, Sharon. And next speaker is Shanthi Karamchidi. I probably butchered that name, sorry.
Mr. President, members of the board, Mr. Byers, good morning. My name is Shanthi Karamchedi. I'm the program manager with Star Vista Differential Response, also known as DR. I'm here today to speak in support of appropriating Measure A funds to support child abuse prevention programs. DR is San Mateo County's child welfare early intervention prevention program to address calls coming into the hotline. CPS assesses all calls for safety and risk to the child. If risk and safety factors are low to moderate, then the family receives DR services. DR provides case management to help families connect with needed services, resources, and support to address the underlying risk factors so that families can be successful. The goal of our program is to reduce risk factors and prevent families and children from formally entering the child welfare system. In the past 5 years with the program, there's been a steady increase of cases being referred to our program. In that same time, our budget had been reduced to half. Caseloads ballooned from a norm of 12 to 15 up to 25 to 28, leaving caseworkers frustrated, tired, and burned out. As of January 2013, our program funding did increase. However, we have not seen that trickle down to other prevention programs and early intervention programs. The programs currently are so limited that the wait lists are up to a year for our families to receive services. Every day, we struggle to find services and programs such as childcare, job training, parent support classes, mental health services, to name a few, to help address and alleviate factors contributing towards child abuse and neglect. Child abuse and neglect is preventable. Studies conducted by the World Health Organization, American Humane Society have found that early intervention, community-based programs, work in partnership, have found to be most effective and successful in empowering families. With increased number of referrals to programs such as ours, I humbly request the board to consider being proactive in appropriating the necessary funds to address child safety and well-being. Thank you.
Thanks. And next speaker is Martin Fox, and then followed by Pat Baum.
Mr. President, members of the board, I'd like you to take note of the assets that we have in the Human Services Agency to bring to bear on all these problems. Carmen O'Keefe and the head of the Human Services Agency's Vocational Rehabilitation Service, John Joy, should be commended, along with the director of the Human Services Agency, Beverly Beasley Johnson. Their VRS 550 jobs program increased engagement of the AB 109 population from 27% before last October 22nd to 93%, and increased employment from 17% last October 22nd to 34% in just 3 short months. Please recognize John Joy and Carmen O'Keefe's outstanding accomplishment, and keep in mind that Beverly Beasley Johnson supported the County Veterans Services Officers Jail Inmate Outreach Program, which began last year. We need to encourage good people like this who have good ideas that produce evidence of positive outcomes without placing the health and safety of others at greater risk by experimenting. The $1.4 million social science experiment by the Family Services Agency of San Francisco, known as Prevention and Early Psychosis, began last year. The father of a man living with mental illness complicated by the lack of insight needed to seek treatment voluntarily told you that the PrEP program had failed to create treatment compliance behavioral situations during the Measure A workshop at the last board meeting on February 12th. All of the individuals who recommended experimenting with unproven programs like PrEP on those who lacked the insight needed to seek mental health treatment in their February 5th memorandum to the board, and their handpicked supporters were also present at that Measure A workshop. I expressed admiration for that parent who refuses to give up on his child. They did not. They have not acknowledged PrEP's failure. What a contrast with how Carmen O'Keefe, John Joy, and Beverly Beasley Johnson have responded to people's needs.
Pat Baum.
Good morning, Board President, Supervisors, and Mr. Beers. My name is Pat Baum, and I'm the Executive Director of the Daly City Peninsula Partnership Collaborative. And since 2006, we have worked in partnership with the county on differential response services. And in that capacity, we have seen, of course, as Dr. Locke had illustrated, the market increase in the number of cases that have been reported to CPS, 29%. And we have responded by trying to accommodate differential response services in our county. And in fact, we've seen a marked increase in domestic violence and substance abuse in our families, along with the socioeconomic factors that create, vulnerable families in our area. In fact, in Daly City, 14 of the 19 schools are now considered Title I. which means that, of course, they have over 51% free and reduced lunch. And I'm proud to report that in Daly City, there is no stigma when the children get in line because they have scan bar cards, and nobody knows except the computer who has free and reduced lunch and who doesn't. But in regards to the domestic violence increase, our department has responded by partnering with CORA, and we have established a Spanish-speaking domestic violence support group. It's the first of 3 that we plan to continue to do because we see the need for that. And when we work with the Child Protective Service Department, we at times with our Path 1 and Path 2, we need to have a warm handoff so that when the social workers have deemed that the children are not at risk, they hand it off to the DR community workers. And we are very sensitive to the caseloads that they have in their department. When we schedule these warm handoffs where we go in together with the family to assess their needs, we really work very hard to accommodate the social workers' schedule. Because we know how heavy their caseload is. So I heartily endorse strategic use of Measure A funds to help that department. Thank you.
Thanks, Pat. Okay, that concludes the HSA report. Next is kind of a controversial item. It's a Coastside Adult Day Health Center to conduct the Pacific Coast Dream Machine event at the Half Moon Bay Airport on Saturday, the 27th of April, and Sunday, the 28th of April.
Thank you,
Mr.
President
Porter.
Horsley, members of the board, Ms. Jensen, and Mr. Byers. Staff is before you today for a presentation or a brief presentation on an agreement for the Pacific Coast Dream Machines event that's scheduled for April 27th and 28th. 2 changes that are notable that I'd like to bring to the attention of the board. One is the demolition derby that was proposed last year has been deleted from the event. And the second change, which came up quite recently, is that the motorcycle freestyle jump exhibition will be deleted from the event. So that's item 11 in your attachment A, as well as the agreement. If the board chooses to approve this agreement, we would suggest that the agreement be amended to delete that portion of the event. And again, that's the motorcycle freestyle jump exhibition. And that concludes my report. I'd be happy to try to answer any questions you might have. We do have representatives from the event here as well, so that they may be able to answer questions you have as well. Thank you.
Just one question, if I may.
Go ahead.
Last year there were also the monster truck rides, although I don't see that on the list. I assume those are not authorized.
Yeah, no, my understanding is this will be vehicle exhibitions, airplane exhibitions. There will be no monster truck event.
Any other questions? Thanks, Mr. Porter. David Vesperimi, you wanted to make a presentation on this item? I don't know. Could you fill out a card? Oh, you did? Oh, I should have it? No, I don't have it. You have it.
Sorry.
Okay, thanks.
I have some slides as well that we'll be looking at together. Thank you for allowing me to speak today. I'm a more than 30-year Moss Beach resident, Moss Beach being the hosting area for Dream Machines at the airport. I'm actually not sure if this is going to forward through because it's a PDF as opposed to, does it? Okay. And I'm also speaking on behalf of a number of fellow residents and neighbors that are equally concerned about this event, but we're not able to make it today during the work week. So moving on to, oh, there we go. Okay. So I understand that there's been an 11th hour adjustment to the permit application, and the applicant has agreed to withdraw the demolition derby. I was a little bit unclear as I put this deck together last night whether the other motorized activities were also eliminated. I've now heard that the motorcycle freestyle jump is off, as well as the monster truck rides. I believe there are a couple additional motorized events that aren't accounted for. The motorcycle races, there's some go-karting activities. So it'd be good to get some clarity if those are all off the table or not. But I think that what we can be really proud of is the fact that in the 23 years that this event has been taking place, this is the first time that there's been any meaningful public input on the issue, and I'd like to see this as a start to creating a dialogue with all of the stakeholders so that this event can be under more scrutiny and run in a more transparent fashion, in particular with respect to the Mid-Coast residents and the stakeholder agencies. To that effect, I'd like for the Board of Supervisors to consider today requiring an internal task force working with both the applicant and all of the relevant stakeholders to resolve any outstanding issues, both for this year's event and for future events. Again, historically, the marriage of airplanes and classic cars is a point of local pride for the coast side, and I don't think historically anyone has a problem with the event or its reason for existence as a way to charitably raise money for the Coastside Adult Day Health Center. I think everyone's on board with that and applauds that purpose. But along the way, the event has changed, and it has gone from being primarily an air show with some static display vehicles into some of what you see here, the demolition derby, the monster trucks. That's the unimotorcycle racing that I referred to earlier in the bottom left corner. It's actually much less of a child-friendly event than it's ever been. I took my own 3-year-old last year, and it was a traumatic experience. The monster truck rides in particular, you'll note that in that picture on the bottom there, there's really no safety barricade between those monster trucks and the watching crowd. There wasn't much more of a barricade, by the way, with the demolition derby cars when they existed last year, other than hay bales. And there's some prominent news stories that have happened very recently showing why that's not a great idea, let alone the fact they have small children riding in these exhibition rides. And the irony being, look at the location that we're hosting this event. It's entirely within the coastal zone, one of the most beautiful areas in the entire state. And you see I've boxed off a bunch of boats there on the bottom. And the question, aren't those really the dream machines? And isn't that something that we can incorporate back into the event to account for some of the elements that are now being taken off of the table? Again, showcasing local pride and bringing a nautical theme into the event. It's literally a matter of hundreds of yards from the historical hosting site. And again, some pictures of what we might see if we just went a few hundred yards away from the airport. Stakeholders, who are they and why should anyone care? Well, we have the Coastside Adult Day Health Center. And I'm going to speak for a minute about the fact that we're at a 2-day event versus a 1-day event, which is historically what this has been. Their charitable take was down by half because the overhead doubled, but the attendance didn't. And what's kind of tragic about that is if you go to MiramarEvents.com, which is the promoter of the event, you'll see that 50,000 people attend this event each year. Tickets prices are $10 to $20, which means that and if you count for vendor fees and so forth and sponsorships, they're pulling at about $1 million, $750,000 in ticket sales alone. Of that, only $40,000 or so goes to the Adult Day Health Center. We can do a much better job for the seniors, and I think we owe it to ourselves to look at that model, especially by using local resources. U.S. Fish and Wildlife has written a letter expressing concern about the impact on Pillar Point Marsh and the nesting bird sites there. And especially you'll note the bottom sentence that they have a particular problem with the 2-day event for 2012 instead of the historical 1-day. As it is, there's been an 80% increase in disturbances, and this has been tracked extensively. There's a new report coming out in just a few months for last year's event. This is the FAA letter. They have $8 million of federal funds earmarked for the Half Moon Bay Airport, and they've called out that anything other than static vehicle displays is completely against their charter. And then the environmental protection specialist assigned to the FAA has pointed out that the presence of where those events were taking place is also red-legged frog territory. And this is
David?
I'm sorry?
Can you summarize?
Yeah.
You're at your 4-minute limit.
Almost last slide. So no motorized sport component. And then this is the spillover into residential areas. You can see that those activities are promoting environmentally destructive activity in and around the airport. So that's enough of that kind of thing, and I really hope that we can improve this event in years to follow. Thank you.
Okay, the next speaker is Laszlo Vesprimi, followed by Bill Mahar. Mahar?
Board of Supervisors, I'm here to ask that the application as submitted for the 2 days of rides be denied. I lived within the Moss Beach Airport for 30 years, and I have witnessed the creeping extension of the dream machines from a simple, old agricultural machine, cars, airplane display to a 2-day county fair / amusement park happening. All this without a single public meeting or input from residents for 23 years. In the past 30 years, I also witnessed a huge increase of weekend events that completely bring traffic to a standstill on the coast. Next to the Dream Machine, there is also Pumpkin Festival, Mavericks, several bike races, and the list is growing every year. There are no hospitals on the coast, and when my second grandson was born, we had to sweat bullets to get my daughter-in-law to Stanford Hospital. And ironically, increasing the Dream Machines to 2 days decreased the contribution to the adult center by half, from $80,000 in 2011 to $40,000 in 2012. In conclusion, please bring back the Dream Machines to the past single day and eliminate non-airport related items like monster trucks and rock concerts. Thank you.
Bill, again, I'm butchering these names, Bahar, followed by Doug Eller.
Mr. President, members of the Board of Supervisors, and able staff. I'm Bill Mahar. I live in Montera, and I am on the Board of Directors of the Coastside Adult Day Health Center. I wear another hat. I organize the food booths for the Dream Machine as a volunteer for that event. And I know that most of you understand that this is a primary fundraiser for the Coastside Adult Day Health Center that has seen its other sources of funding diminished over the recent years. So it's an extremely important event from that standpoint. I think there are people here who can probably debate the issues that were brought up by the previous speakers about the event, even though going to a 2-day event that the net proceeds plummeted. I think that's wrong, and I don't have the statistics here to take the other side of that argument, but I think other speakers after me will be able to do that. One of the things that you may not know is that in addition to it being the major fundraiser for the Coastside Adult Day Health Center, in my capacity of organizing the food booths, you have other nonprofits in the community, namely the Knights of Columbus, the Sheriff's Athletic League, the Boys and Girls Club, Coastside Hope, the American Legion, and the Lions Club all participate in the food area, doing hamburgers, hot dogs, other food items. So if this event were to be jeopardized for any reason, then all of those organizations would lose one of the most substantial fundraisers that they have for the year over in our area. Thank you very much. I can answer any questions if you have them.
No,
Okay.
thanks. Doug Eller, followed by Chad Hooker.
President Horsley and members of the board. My name is Doug Eller. I've been a volunteer at the Dream Machines for 20 years. I'm going to talk a little bit about what we do to prepare for this event. And I'm just going to give you a dusting of what goes on. We're going to start out 2 days before the event starts. We're going to in place about 1,000 feet of chain link fence. This chain link fence is to separate the aircraft from the people to ensure their safety. It's also used to guide people in and out of the areas where automobiles are and airplanes are. It's a safety concern of ours. We put barricades around the taxiways that we close to keep automobiles off and to keep people off of those taxiways. The thing we do on event day during this is we supplement this chain link fence with volunteers from the Sheriff's Department who patrol it. They're aviation volunteers. They patrol this area to prevent people from coming out there and getting in the way so we can maintain a safe operation. While we're doing this, we're going to lay a mile of rope. The rope is to barricade and protect airplanes from static displays, people, so on and so forth. We patrol this rope line. with Civil Air Patrol cadets. Everybody gets involved, everybody helps. We're going to put out tons of signs. 2 days to put out the signs inside the field, a day to put them on the outside of the field. With all of this, we're going to bring in hundreds of porta potties, both handicap and regular. We're going to bring in truckloads of wash stands for all our people to maintain cleanliness around the food court area. And all this is done with volunteers. One of the nice things about this event is that we have, everybody that volunteers is really enthusiastic about it. We're going to put in porta potties. I mentioned those. Actually, we've got there's tons of things I could talk about, sir. But
could you just summarize, Doug?
Yes, I will. One of the problems we've had in the past is traffic. We've worked on our traffic. We finally got a turnaround. We do a turnaround event. 2 years ago, it worked very well. 2-day event came along. And man, believe me, that was a miracle for as far as our traffic goes. We have solved our traffic problem on Highway 1 and on the coast and on the Dream Machine itself.
Thanks, Doug.
Thank you.
Chad Hooker, followed by Janie James, escorting Ray Martini, who's a World War II veteran, and actually a hero at that.
There's another of these that I was handed.
You can, Chad, you're the chair. You can have additional time if you need it.
Thank you. I do have some comments, Mr. President and supervisors all. I am the chair of the Pacific Coast Dream Machines event. This is our 23rd year that we're going into now, and as you all know and has been expressed here today, this is the primary fundraiser for the Adult Day Health Center, and pretty important to the center. It has grown successfully and safely now over all these years. And as Doug ably outlined, we have made a very serious effort to put together a quality show that people enjoy, where safety is our #1 issue. The idea that a great many people can go to a field and see the variety of equipment and so on that's there and really be able to interface closely with this can easily be portrayed in photographs that make it look like there's some sort of a reckless thing going on out there, but that is absolutely not what's happening. Doug also addressed the issue that our traffic has gotten a good deal better with a 2-day event, and that is true. The idea of throttling it back to a 1-day event will increase the traffic again. In terms of general comments, I have some notes I've made here, and frankly, I'd like to just kind of read them. Those of us who try to help a good cause and try to make a difference in the public sector have, by virtue of volunteering, elected to tax ourselves with a great deal of work on the project at hand. And in this complex world, that can be quite a large burden, as you board members know all too well. It's a lot of work to do something like this. What we're talking about here with the Dream Machines is the responsibility of the delivery of a service, an event, a promise. In the case of the Dream Machines, a promise to our seniors. When an organization or board sets out to develop such a fundraiser for the public benefit, it can only succeed if the event is well planned, executed, safe, and fun. And that's been our endeavor, and I think we've succeeded. These objectives have been met with the Dream Machines, as under discussion today. To improve the project, public input is good, and we are certainly open to the idea of a public meeting and the input that we can get. We did not do that this year. We've not done it prior years. We can certainly arrange for that and get public input. Ideas can come forward. Implementing good suggestions can frequently enhance the effort at hand, but input needs to be with that intention, not with the motive of stopping the event. And that's what I'm here to speak about. Every committee knows that there's this graceless age of objectionism where a few people are against what's going on, and the fact that the majority of people enjoy it or like it doesn't necessarily carry that much weight. And I think we should be extremely cautious about this. If an additional permitting process of any kind is to burden this event, we will find ourselves endlessly embroiled in an entanglement of committees and conferences and permits that won't improve the event in any way. Once a permit process is established, it doesn't go away. It gets more difficult each year, more arduous. The permit is the root word of permission, and what can be granted can be denied. So we are very concerned about the idea that somehow this should be cast into another level of supervision. We are completely open to the idea
Thanks, Chad. Thanks.
Okay.
You got your 4 minutes.
Thank you.
Ray Martini is, again, a World War II vet. He was a decorated pilot during World War II, and I think some of us probably have seen him at the Farm Bureau. And Ray can have as much time as he wants.
This picks up. So he doesn't need to speak directly into it. My name is Janie James, and I'm the Executive Director of Coastside Adult Day Health Center. And before we start, I just want to thank you all for all of your support throughout our last 30 years, past, present, and future with our new facility. I brought Ray with me today because he is one of our clients at the Adult Day Health Center. We have many clients like him. This is one of the famous ones we have, but he has a few words to say about the center, and I really just wanted to bring him because a picture says 1,000 words, and I could come up with, some kind of presentation for you, but having my clients talk, I think, is much more impactful. And so Ray's got a few words to say about the center.
Sit down.
By the way, Ray is 93 years old.
Well, the first thing I want to say is what comes out of my mouth actually happened. I was no hero. I just had a job to do, and I did it. And my remark is, you can't kill a dumb Italian, and that's why I'm still alive. How I joined the Air Corps was Air Corps in those days. It was a branch of the Army. Today it's Air Force. So if I say one way or the other, it's Air Force today. But how I joined the Air Corps, I was born and raised in Moss Beach, on the corner of Sunshine Valley Road. And the draft was on, and I turned 21 on December 29th. And I didn't know whether to join the Navy because I didn't want to join the Navy because I didn't know how to swim. Didn't join the Army because I didn't want to walk. I never even thought about an airplane. So I just went on I was an apprentice plumber learning the plumbing trade. And I ran into a friend of mine that I went to high school with. His name was Gino. And I called Gino in town. I said, Gino, what are you doing about the service? He said, well, I'm going over Saturday to the University of California at Berkeley and take the test for the Air Corps. He said, I took it 90 days ago and I flunked. And you got to wait 90 days to take it again, so I'm going over Saturday. I said, oh, I said, can I go with you? Yes, I'll pick you up. So he picked me up, we went over and took the test. He flunked again and I passed. And I was told to come back Sunday, take the physical. So I went over Sunday by myself, took the physical, passed. I was sworn in and I became part of the Air Force, or Air Corps in those days. You got to forgive me a little because my memory is getting a little goofy and I'm going to get forgetful. What was I talking about? And so I came home and they told me when I was sworn in, we'll call you in a couple of weeks and tell you where to report. And I said, okay. So I went home. I was learning plumbing trade. I was an apprentice plumber working in River City. I quit my job, sold my car, sold all my stuff to get ready to go in the Air Corps. They never called me for 6 months. I ran out of money, I ran out of everything. But finally, anyway, they called me and I went to Texas. I got a train over in Berkeley. They told me to be there. And they took me to Texas. And we trained for 1 year in Texas. I met some of the greatest people in the world. 38 of us met in Texas. Took all our training there. Went to the East Coast in Boston. Learned to fly the P-47 Thunderbolt. And then the 373rd Fighter Group was formed, and we became part of it. And that's the last group to go overseas as a group. After that, it was a replacement. Somebody gets killed, they send a replacement. Excuse me. So we went to Boston, learned to fly the 47, then they formed the 373rd, went to North Carolina, and formed the 373rd Fighter Group. Then they called us and we went overseas. And we landed in England, in Scotland actually, north, and then come down to England. A little town called Woodchurch, a little south of London. And that's where we were based. And started flying a couple of missions over the English Channel. And there's a couple of missions that I flew there, very memorable to me. But the third mission or fourth, I forget which, we were going across the English Channel. Four of us in our flight. And foggy weather, worse than Half Moon Bay fog. And we were flying around 2,700 feet. And my flight leader was leading. And he calls the squadron leader, hello, butcher leader. He says, are you diving? And I noticed we were picking up speed. Because if you flew an airplane, you can tell you're picking up speed. He said, no, I'm flying straight and level, 2,700 feet or whatever it was in material. Flew a little more and picking up more speed. And I said, what the hell is Brock doing up in front there? He's diving. And again he called, and again he got the same answer. No, I'm flying straight and level. And then when he finished that, but I can never forget this till the day I die. Brock went into a steep turn to the right and went straight down. And I screamed at him, pull up, Jim. You're never going to make it. And he hit the world. The water blew up, lit the whole channel up. Because we were loaded with gas, we had just taken off. And external tanks and everything. That's something I'll never forget till the day I die. Oh, God, I get forget what I'm talking about. So then we were stationed there for in England, a month or two. And then they sent us over to France, right on the East Coast, on the English Channel. We flew out of the missions there a few days, and then when they transferred to I can't remember the damn name. I had it in my tip of my tongue and I forgot it. And then we flew out of there, and then they gave our squadron a job to support General Patton's army across France. And this is the hand that shook the hand of General Patton. He was there to win a war, and I have a lot of respect for him. I mean, a lot of people talked about him, and he was a big loudmouth and everything, so he was a loudmouth, but he was there to win a war. And our job was we'd get a call from Patton's army that they had Highway 92 and Highway 1. German tanks are holding us up in the trees in the right corner, so when we'd go there and dive bombs straight from. What?
Tell them about the health center.
Oh, I will, okay. I'll get to that at the end. I'm going to talk all day. It's okay. Where was I talking? Oh, we supported Patton's army, and our job was Patton's army would call us and say we're being held up at Highway 92 and Highway 1, go there and dive bombs. So that's what we did all the way across France. And finally we moved up to, I forget the name of the town, and we were stationed there. And then one day Colonel Wheeler called me to his office, and he said, Ray, I got a good offer for you. I said, what's the offer? He says, well, I forget his name. He was the operations officer, and he got killed. He said, the job is yours because you're the assistant to him now. The job that goes with it gives you a promotion to major, and the pay goes with it. I said, geez, that's great. He said, but there's a little catch. I said, what's the catch? He says, you got to fly 25 more missions. I said, I'm sorry, I'm going home a live captain, not a dead major. He said, that's okay, Ray, do whatever you want. So 2 days later, I got my call, and I was sent back to the United States. I flew a total of 50 missions. They couldn't kill this dumb Italian.
Ray. Can you just say one word about the adult day health.
Oh yeah, I'm just gonna get to that. I'm forgetful. Yeah, I can't help it. Anyway, I belong to the. They got me into adult daycare center over in Half Moon Bay, and I was sitting at home watching that damn boob tube all day long in the chair. I got a sore butt from sitting in the chair. And what was I talking about? The adult care center. So a friend of mine took me over to the adult care center, and I became part of that. And I'll say that's one of the nicest things that happened to me, because it helps me pass my time away, and everybody else there with us. The people who work there are fantastic. I mean, whether they get paid or work for free, I don't know, but they are wonderful people and really helpful. And I've been going there ever since. I missed a couple of days a few days ago because I had bad health and couldn't make it. So I had to stay and watch that boob tube again. I'm trying to think.
That's good. That was good. Thank you. Thank you.
I was going to say something else, but I forgot. I'm sorry. I guess my memory is bad.
That's okay.
Thanks, Ray.
Thank you. You can sit. I'll take care of it.
So it is my privilege to be able to run the Adult Day Health Center, and this is why.
Thanks, JD. And it's Catherine Slater Carter, followed by Eddie Andrini.
Good morning, Catherine Slater Carter. I am elected to Montero Water and Sanitary District, but I am speaking as an individual. Good morning, members of the Board of Supervisors, and welcome, Supervisor Slocum. I support the two-day Dream Machines. I think it is, how can I top what Ray just said, but it allows the community to come together in support of our community members and our nonprofits. I'm sorry there won't be a destruction derby. I missed it last year. I was out of town. I actually do think it's important for kids to see what happens when cars hit each other. And it has been a part of our community for a lot of years. Frankly, I live not far from the end of the airport, and I've learned if I don't want to be a part of the event, I get my groceries on Friday and I enjoy the weekend at home. Yes, we do have a lot of need in our community, and this is one of the ways that our community supports itself and takes care of our own. It and Pumpkin Festival and all the others. And so my point here is to say thank you for the Board of Supervisors for allowing it to be 2 days, and especially to thank the entire community, all of the volunteers who spend their time and their efforts in taking care of our special part of the world. That's what makes us a real community. Thank you very much.
Thanks, Catherine. Eddie Andrini.
Good morning, Board President and the Board. Ed Andrini, Half Moon Bay. I am with the Half Moon Bay Pilots Association EAA group, and I volunteer there, and my role is to special attractions for aircraft and deal with the county staff at the airport, and those issues, and the FAA. And we've had a great working relationship over the last 20 years of the event. I do support the two-day event. The event did bring in a little bit more net on a two-day event than it did on the previous one-day event. I don't know where the figures came from before, but one of the other things about the event, there are all sorts of nonprofits that are working there and benefit from it. And the Coast Side has all these different events, Pumpkin Festival, the marathon, because we don't have the resources on the Coast Side. So that's the purpose of all these events, to support everybody from the 4-H clubs to Boy Scouts to Civil Air Patrol to everything there. And the event is, one of the other things about the event, though, that no one ever sees is that the FAA, I know the Sheriff's Department, the ham radio operators, we use the event as a training aid for natural disasters. of the coast, because if there's an earthquake, we're out, our road service is closed off, and the only access to the airport or to the coastside is the airport. So it becomes a training exercise because San Francisco Tower comes over, sets up their tower. Their tech op guys use all their emergency equipment from SFO, and that's their training exercise. The event is used as a training exercise. Sheriff's Department has their emergency response. First responders are there. Cal Fire is there. So the whole thing is used as not only to support the event, but as a training exercise for the coastside.
Thanks, Eddie. This is it in my district, so I'm going to make the motion to approve the agreement with the Coastside Adult Day Health Center to conduct the Pacific Coast Dream Machine event at Half Moon Bay Airport, Saturday the 27th and Sunday the 28th.
Second.
All in favor? Aye?
Aye.
Okay, thank you. I'm going to take a 5-minute break at this point. I just, you know, one thing is that, no one, okay, we'll begin again. We're back in session, and we are now on item number 7, the report on Measure A spending priorities and next steps.
Mr. President, members of the board, Reina Ferrales is going to present the county's response on this item.
Okay, good morning, Mr. President, members of the board, Ms. Jensen, Mr. Byers. Actually, Mary McMillan and I are here today to report out. At your last board meeting, you asked that we do a recap of the Measure A spending priorities. And so today we're here to get any comments or questions you have to start narrowing down the universe of priorities for Measure A. And Mary and I are here to give you an update on some of the other things that are going on. So we did execute a contract with Socrata to do the Measure A dashboard, so that is underway. And we did present an open data policy to our department heads yesterday, so we do have an open data policy in place. I was just talking to Locke about his great presentation and the need to get all of that data into our dashboard so that the board can make decisions around the priorities for Measure A. So with that, I'll turn it over to Mary, who's been working with the board subcommittee on oversight committee membership.
Mr. President, board members, Peggy, John Byers. I have just a couple of things to update folks on. We are meeting to discuss the oversight committee that is required under Measure A. We've looked at some of the best practices in our community, particularly the schools, and have brought that model back to the group, and they're taking a look at that. It'll come back to the board, I believe, sometime in March for your consideration, and that would create a body that would provide oversight, look at how the expenditures are made over the next 10 years, not just the next year, and retain an auditor to make sure that there is an independent audit of those funds, and that would all be reported in a very public, transparent kind of way. The group would undoubtedly be subject to the open meeting laws. Secondly, we're working on an outreach plan that will really move forward once your board does set priorities, and we'll be able to put those priorities into more focused kinds of categories, and then I think we'll have a much more directed campaign out into the community. We'll continue with outreach to define how those funds are to be spent both in the first year and out into future years. And along those lines, we'll be making sure that the outreach and the communication plan, not only through dashboards but in other mediums, tells the community how those funds are being expended and what those benefits are to the residents. So that plan will come back to you in its entirety once you've adopted your priorities. We've also kicked off something called Mind Mixer. I shared that with you, I think, about 10 days ago. We pushed it out to our list, and lo and behold, this morning I'm told that San Mateo County is #1 on the Mind Mixer list. They called and wondered what we're doing because there's lots of people logging on at SMC Speak Out and giving us their ideas on how to spend those funds going forward. And I think really I'll stop there and be happy to answer any of your questions. Again, the outreach effort and oversight is not just for the first year, but making sure we look forward for the entire 10 years for the transparency and accountability of those resources.
Any questions from the board members?
Just a comment. I'm sorry, did I?
No, I don't have a question, but I have comments also.
So let me, Supervisor Groom?
There's three things that are not on this matrix that I've talked about for several meetings, and I want to make sure that they get captured. The first is early childhood education. This combines the program that the county has been doing with the County Office of Education and the Silicon Valley Community Foundation to create an infrastructure for a better early childhood education system. The second is mental health services in the middle schools, or some sort of program in the middle schools. And the third is, in addition to parks implementing deferred maintenance, I was hoping that we could look at all of the county's infrastructure, what we haven't, what has not been done, what should be done in terms of long-term capital improvements. And I know we have the capital improvement plan, but somehow I think part of that has to be transferred to the Measure A priority list.
Supervisor Pine?
The comment I wanted to make just after Mary spoke was I think it's great that we're taking steps to use some of these online tools to solicit input and to use some of these online metrics. So I think that's really going in the right direction. On the substance of the categories and the summary of things we've talked about in the past, I really want to echo Supervisor Groom's point that we really need I think a separate box here for this early childhood education, early care. And there's a lot, as we all know, there's a lot going on in the county right now on that initiative. Not only is there an ad hoc committee under Carol's leadership, which I serve on, but the Peninsula Partnership Leadership Council is working very hard. We have some people in the child care partnership that are doing some very forward-thinking, really state-leading work on this. And so there's a lot of good ideas germinating, and I think the hope is that between the county, the foundations, the schools, that we might be able to do something really significant. But that we'll have to make some contribution there. So I think that one kind of really stands on its own. I would suggest it just kind of be put in a box because there's a lot in there. It's a little, we have early intervention, but this is really kind of its own. It has its own importance, and just to repeat something folks are aware of. I was just so struck with this yesterday, attending the First Five Commission, where Stanford's done some incredible research on the success of the preschool program we had in Redwood City for many years, and the data is just incredible. And we talk always, and we all know that these investments in these kids are so powerful, both in terms of helping them get on their way, but also saving us, tens of thousands of dollars down the line. So anyway, just so struck by that, as you always are when you see it. So again, just want to echo the importance of calling that out as kind of a bucket to think about.
Supervisor Tessier?
I want to echo what Carol talked about as far as trying to leverage some funding with the Silicon Valley Community Foundation and working on a lot of these, early intervention programs. I did note under child safety, it talks about school safety. I think along with that, and maybe it should be its own box, on the issue of mental health. We are doing a summit on the 29th of April that's going to talk about school safety, violence in our schools, and also the mental health issues around children in our school or lack thereof, and what can we do to leverage the county's resources along with the schools to make sure that those individuals that are identified at school as having some difficulty do get that help. So, but I do think maybe rather than put it under that, I think a standalone, because it covers more than just the children, it covers a lot of individuals, but that is one that we're clearly working on because there's just not enough help in the schools on that. So anyway, I agree on those issues.
Supervisor Slocum?
I just had a question. Thank you. Mary, maybe you can help me understand, on the memo, it says the Measure A work plan will be presented to the board's Measure A subcommittee before March 29th. Could you just describe a little bit what that work plan might be?
As it relates to outreach, yes, we'll probably come back to you with a work plan that describes the different community forums that we would have, the different technologies that we would use, the different groups that we would be reaching out to that we may not have engaged thus far. So those would be the immediate efforts. And then going forward, it would be how would we be reaching out to the community over the years, in terms of, is it an annual report that is provided? Are there, besides the website that is created, the ability for folks to really understand how the dollars are being expended? I know that the group that we've retained to take a look at this is trying to come up with a very smart campaign going forward in ways that people might not always see what we're doing. So new ways of getting out there. So we'll bring the entire plan back to you. More?
Actually, I have one question on that too. So, actually, we have a subcommittee, that's one thing, but I just have some confusion about, we were supposed to also set up an oversight committee of citizens, and I thought each one of us would make a recommendation of one or two people, and that oversight committee was supposed to essentially kind of audit the funds. I do support, I like the idea of using your mind mixer, these technologies to get more information. It's great. I think the idea of having community forums to get more input, to have a plan, but essentially the plan really ought to be the priorities of the board, as in that oversight. The citizen committee is really more of an audit committee, in fact, I think that's how we described it in the authorization of the language.
Absolutely. And the subcommittee is looking at the creation and establishing the oversight committee, which is required by the actual measure. And I believe they're looking at a draft to bring back to the board either the 12th or the 19th of March that would in fact establish the oversight committee and do exactly that, seek input from each of the board members to make sure that the participation of the citizens or the residents that serve on the oversight committee are in fact from each of the districts and from different diversity in the community. So that's coming back to you. And
I thought what I heard Supervisor Horsley said is that we will submit names. I mean that's one of the things that I haven't exactly heard.
Yeah. Do you want to speak to that?
I think since it hasn't come back to all of you, that is what we asked at our meeting, was of Mary to go see how they did it at the community college district, because we heard they had high marks on how they did the oversight on the bond measures. And so basically what we're going to bring back, and it's not completely finalized, was basically the board members submitting names, but we do want a diverse group of individuals from different walks of life, so to speak, maybe an accountant or a business person, and then an individual from the community or something. So we want to really round it out, but we're going to suggest the names come from the board members, and if I suppose if the public wants to give individual board members some ideas, that's fine too. And there's sort of two purposes. I mean, if you looked at the measure, one was an oversight committee, which would be this body that takes a look at, if we say these are the things we're going to do, they're going to make sure that we're actually implementing what the board approved as far as the Measure A funds. And then the second part would really be an independent audit, a financial audit, to be sure that those dollars, by Macias or whoever does our independent auditing. So those are sort of two separate functions. So the Oversight Committee itself isn't doing the auditing. They're making sure that what we're putting forth and using the dollars for are what we said we were, and the other one is to make sure those actual dollars financially are in line and accounted for. So, so that's going to come back to us in March, and we're sort of almost there anyway. But that's the idea behind our discussions so far.
So the oversight committee is going to review what your expenditure plan is, and making sure over the next years that those funds mirror the expenditure plan.
Supervisor Tessier?
I had a question, Mary. You know, we have all these funding priorities, and you've got the list, and it says, you know, what potential uses could be in these different categories, and it talks about the report backs. You know, for instance, the parks, I think there's been a strategic plan that's been put together already, or at least it's in a draft form. So at what point are we going to start seeing these timelines and presentations coming to us? I know we're not going to do it all at once, but we're going to try to take some of them, review them, and give the nod, and then, you know, by the time the budget comes around, we should have, you know, from soup to nuts as to what we want to do with the Measure A funds. When are we going to start seeing those individual report outs?
My understanding is from speaking with the county managers that they will be put together in like topics, so that, for lack of a better term, they'll be ganged together. So if you're going to cover all the different issues around the parks, you're going to hear them on the same day. So I think there is a plan in the works from the county manager to put some of these things into really workable kinds of categories that then are scheduled out and brought back to you over the next several months.
And will they be at our actual board meetings, or will these be separate workshops around those individual?
I have board meetings.
Supervisor Tissier, so we are planning to check in with the board along the way. So after we have your comments today, we'll work with our departments to make sure that we have dates assigned to each of these categories so that we can start bringing back information. So the goal is to have a Measure A budget package that will go to the board as part of the larger budget. So budget packages are due to our office at the end of June.
Can I interrupt you?
Sure.
When you say part of the larger budget, the budget's going to be actually heard and finalized in September. You're not talking about waiting until September, or are you talking about an earlier process for Measure A funds?
Well, we could certainly take a separate package to the board towards the beginning of the new fiscal year. Because right now, the timing of the budget is that the requests from the departments will be coming into our office at the end of June. And then the budget will be prepared and presented to the board in September.
But maybe I wanted some clarification on the question I was asking. For instance, if there's a strategic plan, say, that comes to us next meeting, board meeting around the parks, a strategic plan, could the board at that council meeting, after they review it and look at it and give you the feedback, say, okay, this, we want to be able to start implementing this. We want this to be part of our budget starting in
Yes,
July
this
1.
is part of the priority setting. Is over the next 4 or 5 months, is to take information to the board like the strategic plan for you to be able to say, this is something we want to include in the budget, but will be funded by Measure A funds.
So we would give an approval at that particular meeting for a certain amount of funding for, say, the parks. I'm using that just as an example.
Right, so those are our check-ins with you, will be to set those priorities and get them in the budget.
Supervisor Groom?
When will we have dollar amounts assigned? Because in setting the priorities, knowing how much it's going to cost is a part for me of what's a priority and what isn't a priority. Because I won't give an example, but when will we start? So when will we have this report with its metrics and dollars assigned to it?
And that's what we need to work with departments on, Supervisor Groom, is after we have the list and include all of your comments from today, we'll work with the departments to start assigning dates to these and dollar amounts, and then bring that back to your board through the work plan on when you would start seeing those individual packages. Because there is a lot of work to be done around getting a lot of the data. If you look at service gaps and inventory of services, that will take a little bit of time over the next 3 or 4 months.
Supervisor Pine?
Yeah, just, you know, when you look at the current breakdown, you know, we have 13 categories. We might have added 1 or 2 today. So, you know, even if we did 2 or 3 a meeting, it would take a lot of meetings to get through all this, right? And some of them, of course, much more straightforward than others. But I think we should start bringing to the board, you know, right away. Because, you know, some of these are more thought through than others. But, I mean, I think each of them requires a fairly substantial discussion and deliberation by the board. And maybe after each, we say, you know, we think this looks reasonable within a certain range. But it's hard. It's going to be hard to make a definitive decision after seeing one because there's going to be 6 or 7 coming after. But so, for example, like parks, we're all very supportive of parks. That one is kind of all keyed up. We know there's a plan that will come forward. Board members can react to the plan, and I could foresee the board members saying, well, somewhere between X and Y or something. I mean, it would be hard to say, we're going to do this exact amount because we get all the other things to come later. You'll get a benefit from going first. I don't know. It's just a. I think these things need to come in chunks, and we should start bringing them as fast as we can.
Right. And there are some things like parks where they're almost ready to go.
Yeah.
And health has already put together a lot of that analysis.
So let's bring 'em
HSA as well. So we'll pace those things and make sure that those get to the board quickly in cases where we already can.
President Horsley, if I may, I think what we will bring back to your board is a plan and a list of dates where we will report back on specific items. That will depend, as Raina said, about when we can get the data available for folks. But now that we have a finalized list with all of your input, the next step is for us to put together this program. We'll bring that to you. And regarding Supervisor Pine, your comment, I would see that you essentially could put placeholders around certain areas, and then when we come back with the final budget, you could then decide, all right, this is how we want to make the final allocations. We recognize that you can't make a final decision during the process, but we want to get you the information so you can have a sense of what the costs would be and then make some decisions about what that would be, if that makes sense.
It does make sense. Let me go through some of the questions I had on this the list as well. You have Seton, and I assume that we're working with them with the health plan. I know that actually that might be one of the things that comes to us fairly soon, hopefully maybe at the end of March or April. And Pescadero, that certainly covers my South County issues about having a full-time clinic. I don't actually mean a full-time clinic in a sense of a building. I was really thinking more of a mobile van of some sort, and I think we probably are going to be able to find contribution for that. But I really want to emphasize that we need to have a full-time physician for that population there. And one of the things I'd like to explore is not only with our health department. There's also a practice called Purissima Health Services, and the doctor there was at one time the doctor on an Indian reservation in New Mexico, so he's expressed some interest in providing those kinds of Medi-Cal services, and so I'd like to explore that as a possibility. And then on a health department, it does refer to this health department memo as actually kind of a starting point. And actually, I had the memo, and I know that it came from Louise Rogers, Steve Kaplan, and you referred to it, but there's actually a number of things that Supervisor Tessier has talked about, some of the issues about schools, and there's some specific recommendations. And are you referring to all of the recommendations in that memo or some? Because there's recommendations not only on identification of the needs of school authorities or to have mental health services for kids. There's also an explanation about Laura's Law or Laura's Law Light that again is pretty well described, and I think I'm very much in support of that. I think it doesn't all have to be out of Measure A. Some of it could have come out of the MHSA, Mental Health Services Act. Some might even come out of realignment funding, but I think all of the programs, if you will, that are described in that memo are really high profile for me. I think those are really excellent recommendations. Under libraries, we did talk about homework centers, and I would like to specifically call out reading programs at our libraries. I know we've talked about that for the JPA, but there are other libraries that are run by the cities. For example, Menlo Park has a library that is not part of the JPA, and they provide services to Bellhaven. So I want to make sure that places like Bellhaven and East Palo Alto and North some parts of San Mateo, that they get those same kinds of support for reading. Because again, I think that if kids can read, if they're successful in school, that's one of the best indicators that they're going to be successful in life. So I want to emphasize
President
that.
Horsley, may I say something there?
Yes.
We have really robust reading programs in most every library in the cities and in the JPA. It might be helpful so that we could get a compilation of those programs.
Sure.
So
yeah.
we can see exactly what we have now.
And I know I've talked to librarians in some of the cities, like Menlo Park is a specific, that they do not have a program and they don't have any funding for it. And then in parks, we did talk about you include the strategic plan, but I also want to make sure that we remember that the Devil's Slide Park is going to be coming online. And that's about a $2 million price tag, from what I understand. So essentially, those other than that, I thought that the compiled list was excellent. Any other comments, Supervisor
Just one
Tessier?
comment, and I'll use that memo from the Health Department as one. One of the things I want to make sure, again, that we don't lose sight of is there's a lot of good information in there about what we should do and the costs associated, but I also want to make sure in each of these areas that we also look to see if there's any monies we can leverage. In other words, if we're going to look at school programs and mental health programs around the schools have to be a participant in that. There won't be enough money to go around unless we start leveraging dollars from some of these different areas. So I think it's going to be important throughout this whole process that, maybe as one other column here is what's being leveraged in these areas. Because, to me, if I see money can be leveraged, I'd be more inclined to spend these huge sums of money with no other participation. So to me, that's going to be a critical component of this.
Any other comments?
Just Supervisors, we can go ahead and update the list and then bring it back to the next board meeting.
Okay, good. Thank you, Raina, and thank you, Peggy, as well. The next item is number 8, is the county manager's approval funding for 7 grant applications for the first round of Community Corrections Partnership Competitive Grant Program. Oh, wait a second. I'm sorry. Before we do that, I have 2 speaker cards that Kate Comfort Har. I forgot to look on my right side.
That's okay. We won't let you overlook us.
Okay.
Hi, my name is Kate Comfort Har. I'm Executive Director for HIP Housing, which provides affordable housing to 1,400 people every year. I want to thank the Board of Supervisors for the efforts made to take community input on the priorities for Measure A, the community meetings, and the San Mateo County Speaks Out website. As your staff indicated, San Mateo County is very expensive. We are the second most expensive place to live in the country, second only to New York and tied with San Francisco. As a result, I was pretty disheartened to see that the housing, especially affordable housing, didn't actually make it onto the website as a voting category. However, I was really encouraged to see that many people actually typed it in as an additional option and that it did make it onto the county report, the staff report. At least housing as a broader topic did. As you prepare to adopt the staff report on Measure A, I'd like to encourage you to broaden the definition or the concept of housing beyond homelessness to include housing programs that provide affordable housing. Once someone becomes homeless, the crisis is already in place and it's very expensive to repair and to address. Programs like those provided by HIP Housing work hard to create permanent affordable housing solutions in a very cost-effective manner. But housing providers, like my agency, have suffered greatly with the demise of RDAs and the slashes to CDBG grant funding. Providing enough affordable housing and affordable housing programs is critical to addressing homelessness before it happens. We've seen a 30% increase in the calls to our office for people who are homeless, a 50% increase in calls from those who won't identify what city they live in, which likely means that they are homeless or at risk of homelessness. Living in the city means that, let me just close by saying, I'd like to encourage you to address homelessness before it happens and to for you and the Oversight Committee to include social service programs that cost effectively provide affordable housing to the housing priority for Measure A. Thank you.
Thank you, Kate.
Can I make a comment?
Yeah, sure, certainly.
If I could just make a comment, and I notice it isn't here, but they sort of alluded to it. We have talked about the idea of possibly putting money into housing depending on what happens with RDA funds. And, you know, there's still some issues in the courts, so if in fact the county gets some money, it might behoove us to leverage some of those dollars with other cities and being able to do affordable housing. So unfortunately, we didn't spell it out as affordable housing, but it says RDA low, moderate. I think it was intended that we will look at that when we're certain about the RDA funding situation.
Well, and I appreciate that because as a housing provider, we're looking for new and creative ways to collaborate too, and HIP Housing has done a really good job of doing that with, for example, a property that we're working on down in Menlo Park. But I think that that's part of the ticket is how can we leverage those funds and what's available. But I just want to make sure that it's included in everybody's mindset as you start thinking about homelessness as well.
And I think we should add that in that category of housing to revisit it.
Thank you.
Thanks, Kate. And then the last speaker on this item is Martin Fox.
Thank you very much for your thoughtful attention to all of these issues, especially the issue of mental health. I'd like to point out a real asset that you have on your board. Supervisor Tissier has courageously and repeatedly pointed out, especially to some of the members that sometimes show up here, that some individuals who lack insight needed to voluntarily seek help to become productive members of society exist, and they need help. She has acknowledged that the current conditions of existing facilities make behavior change compliance activities less effective than they might be, and a new jail is necessary. Laura's Law creates a treatment compliance behavioral situation that a jail does not, and a mental health drop-off center does not. And that's the common ground that I share with her. She recognizes that you need to have a behavioral situation that encourages people to become productive members of society. And that is what I seek when I talk about Laura's Law, productive members of society. Thank you.
Thank you, Marty. Okay, now we can go to item number 8, County Manager's Report on the Corrections Partnership Competitive Matching Grant Program. Mary.
Good afternoon. Good morning, excuse me.
Good afternoon. Almost.
Mr. President, Mr. Byers, Ms. Jensen. This morning I have before you the first round of the CCP funds that were set aside by your board.
Mary, can I interrupt you for one
Certainly.
moment? It occurred to both Peggy and myself that technically the board needs to accept the Measure A report, and I don't recall if the board.
I would move to
did
accept
that.
the Measure A report.
All in favor?
Aye.
Aye.
And that's, I assume, with the corrections noted today.
Yes.
With the additions.
Great.
CCP report before you reflects the first round of the $1 million set aside that your board created out of the realignment funds to push out to our nonprofit partners, the providers in our community that we partner with to deliver the services to those re-entering our community, very specifically those that are coming back to us from the state under realignment and that are going back out into the community for job training, transitional housing, supportive housing, and in some instances actually are in our community and are considered homeless as a result of their last crime occurred in this county, but their place of residence might be another county. What you have is the first round. It adds up to about $681,000. The priority of these funds are for transitional housing, supportive housing, and job training. The second set of funds we have set aside and put in abeyance until we complete some work around case management. We felt it was terribly important to determine where the case management services are needed in our community. There's a multi-department team that is looking right now at how that should be deployed through the community and mapping where the services truly need to be located. So the second half of those funds would go out once that work is completed. One very unique program, we're funding an actual study out of this to look at new ways to leverage our dollars for realignment and reentry that's much more performance-based, generally referred to as a social impact bond. And we have quite an expert in our community that's agreed to work with us on a feasibility study. So a very interesting effort, and it's terrific that it's afforded out of this effort. And again, the multi-department team, behavioral health, mental health, HSA, the Sheriff's Office, and County Manager's Office all came to agreement that this would be a good effort to really look at using that kind of an approach. The only one that was not funded is already under contract with our courts and receiving funds. If you have any questions, I'd be happy to answer.
Any questions?
No, I just want to thank Mary and her team. You know, this was a lot of work. If you saw these applications, and what I really appreciated, you know, we could have spent all the money, but it wasn't prudent to do so. And so I really appreciate we've only really expended about half, but we're also looking at making sure we're not duplicating the efforts. And I think that's really critical because these dollars really have to stretch over time. And we also want to make sure that we're providing the correct services to individuals and also working with our community-based organizations the best we can and leveraging things. So Mary, thank you and your team.
Thank you. I guess I'd just like to close on one from this experience. When we got all of the providers who deliver these kind of reentry services from Daly City to East Palo Alto, Redwood City, San Mateo, we made sure that this was considered a collaborative approach and that they need to come in partnerships. And we discovered many of these nonprofits, 35, 40 of them, that are out there already serving our community did not know one another. So it's really created a community where there's sharing of information, there's sharing of best practices, they're learning new tools. And in fact, the case management system that we're going to deploy, they're going to actually use as part of receiving the funds going forward. So thank you.
And with that, I'm going to make a motion to approve.
Can I ask you to amend your motion? It turns out that in our realignment funds, as I understand it, the amount of money has been actually doubled.
Yeah, we're going to go from about $4.5 million to 13 in this coming fiscal year. More than doubled. We did well in the formula.
So if you think it's a wise thing, I'd like to see if we could extend those grants for the second year.
Well, I think we should see what comes out of the work from the grants. I'd hate to give the money and not know what the results are.
That's true, but could we keep the grant program going for the second year?
I would say only if it warrants it. I wouldn't want to, I mean, I don't know that we think we've got the right mix here, but I'd certainly like to see the results of the grant monies and what they're doing before I would be willing to extend it a second year. It's probably likely because the numbers will get bigger and the needs will get greater, but we really want to make sure we're doing the right thing. And if it's not working, I'd rather revisit and accept other grants, you know, to see if they do a better job or a different job.
I don't think I'm suggesting we necessarily have to tell the current grantees that they're going to get a second year, but setting aside a second year of $1 million potentially for another grant program.
I guess it would have to come through the CCP to do that. I mean, I can certainly take that back. I think, you know, this is sort of a work in progress, and if, you know, I'll certainly bring it back if you want me to talk about it at the CCP.
I would request that you bring it back.
Yeah, just a point of clarification on the CCP funding. So I know when we started in 11-12, and that was a partial year, and we had $4 million plus, and then 12-13, I think we went to 13 or 14 million.
That's correct.
And so I mean, do we know what the number is for 13? The year forward?
2 years. It's 2 years funding is what the County Administrative Officers Association came to agreement on, with exactly the idea in mind that for 2 years you could really get a program up and running and begin to see its results. And so 2 years. And then on top of it, the CAOs are right now in negotiation over the out-year growth. The first year out-year growth, or the first year growth is a little over $77 million. So we've already started a discussion on how that should be how it should be shared with all of the counties and how that will be based, whether it's on performance or on population.
We asked my question again. Again, in the current fiscal year, the 12-13 year, we have something like 13 or 14. And do we know our allocation for the the next fiscal year?
For the next fiscal
Is it also
year,
13,
it's
14?
also 13.
Okay.
A little over
so I'm
13.
not sure it's actually really gone up because remember that first year was a stub
It
year.
wasn't a full year.
Yeah.
Right.
It's 13, and then we're going to get a piece
Hopefully
of the $77 million of growth.
Across
58 counties.
Well,
58 counties, yeah.
Just one other comment. My concern is that how do you really ramp up a program for 1 year and then ramp it back down? And that seems to me that there should be, grant programs are great, but it seems to me that they should be longer periods of time. You can always shut them down after a year if they're not working, if they're not having any results, but it seems to me that you're asking a program to ramp up in the hopes that, for 1 year, and maybe they get the money next year, maybe they don't. I just don't know how that works.
Each one of these contracts, as we negotiate them, probation, myself, behavioral health representatives, we're negotiating the contracts with each one of the recipients, and they will be performance-based contracts, and they'll have milestones at each quarter. So some of them might not make it past 6 months, let alone a year, where others may be doing a terrific job, and you may want to consider augmenting their work. So they're performance-based, and we'd know how effective they are.
Just before you do that, my experience always been, when I was in a healthcare district, one of the things that we did is our grant programs generally were for 3 years. Now, we could shut them off if they weren't able to perform, but the difficulty was when, one of the reasons we went to a 3-year grant program is that for 1 year, programs had a very difficult time ramping up. And as a consequence, that's why we switched to a longer period of time. So that's why, that's my thought, is that you're asking these grantees to ramp something up that may shut down in a year. It's very difficult.
I think that these organizations are all experienced organizations that receive a lot of grants. I think they probably know how to do it.
I understand Don's comment, and all I'm saying is I'll bring it back to CCP. I think it's the intent of the CCP to like the idea of grant programs because you're really getting your CBOs involved. So I don't know that we wouldn't go forward with 2, 3, 4 years. I think we're being very cautious with the dollars now because we don't know what some of the other effects of the monies are going to be over time with the needs in the community and with our law enforcement, et cetera. So, but I'll certainly, indicate that there's an interest in making sure that, that the board likes the grant program idea, and perhaps we should keep that as an idea for the continued years, unless obviously the performance of any of them doesn't work.
And the Supervisor Horsley, the CCP does have scheduled meetings now for the rest of the year on a quarterly basis. And I think that the promise was to bring back the next case management portion of this, and so it could be a good time to bring that kind of proposal going forward.
I would just ask that the CCP keep an open mind to that, because I know these organizations that, we're first of all picking people that we have a lot of credibility. They've been in New York and in the community for a long period of time. They know this particular work. Nevertheless, to do more, they can't just do it with the existing staff. They have to add staff, and it may well be that they're used to doing that. They're not used to doing, grants that have 1 year life and then die, and then the staff goes. So, in any case, there's a motion and a second. Any other discussion or?
I think it's a good point for the CCP to look at. I think we hear your point exactly, and maybe as this money becomes more stable. Yeah, it would make sense.
Well, the other part, if these work really well, we might up the grant. So you don't know. It's like I say, it's a work in progress, so it's certainly worth talking about.
Wait a second. I have one speaker on this one, Martin Fox.
Thank you again, President Horsley, members of the board. There is a historic opportunity here to enhance the county's reputation for innovation that should not be overlooked. The results of the initial public safety realignment local implementation plan audit in an adjacent jurisdiction were reported in the San Francisco Chronicle a week ago. The lack of affordable housing was the overarching theme of that report. However, their auditor recommended solving their problem by passing the buck and having other counties provide housing to their AB 109 population. The multi-department team proposal recommends $372,000 in transitional housing grants, which is more than half of the $682,000 in grants that you are considering. Providing housing in our own county is a step up from the neighboring auditor's recommendation. However, without a treatment option, it is still a repetition of some of the same policies and procedures which resulted in California's historic 70% recidivism rate. Please fund an evidence-based practice certified by the U.S. Department of Justice as an effective, efficient, and economical crime and recidivism reduction program, assisted outpatient treatment known as Lorazolol. Thank you.
Here we have a motion and a second. All in favor?
Aye.
Okay. So next, we're going to go to item number 19.
All right. Thank you, Mr. Horsley. I'm very excited to see that we have a tenant in a very close to an agreement with to lease out one of our buildings at Circle Star. I did have a few questions about the transaction. I'd mentioned to Ms. Jensen that I would be asking for this to come off the consent. So I don't know if you want to make any general remarks, or I could just go to a couple of questions.
I have a few quick general remarks to share with the board. As you know, the item before you is to request authorization for the county manager or the deputy county manager for community services to execute a lease agreement for 4 floors of Circle Star 1, which is a southern building at the Circle Star complex. We are in the final stages of our negotiation. Our negotiation team has been led capably by County Counsel John Byers with the assistance of Chief Deputy County Counsel Lee Thompson. They have also been assisted on the legal side by outside counsel David Gehrig from Hanson and Bridget. And on the real estate side, our real property staff have been assisted by our brokers with Cornish and Carey. So we've had a very capable team working on this. We are bringing this item to you today because Starburst 1, the potential tenant, wants to occupy 1 floor. It'll be the 2nd floor of the Circle Star complex by April 1st, and the other 3 floors of the building by November 1st. It was the ability to get early access to the building is currently vacant and obviously available to a tenant, that was really one of the key factors that attracted them to our property. To achieve this timeline, to achieve that April 1st occupancy, the tenant needs to have access to the building as soon as possible after the lease is signed. The general terms of the lease were agreed to in late January and are included in the memo in your board packet. Those terms are consistent with the current market for commercial real estate and include the following. The proposed lease is for 6.5 years, ending in July of 2019. There's an additional 3-year option, which would bring the total term to 9.5 years. The rent starts at $2.25 a square foot and has a 3% annual increase. The tenant will pay, this is a triple net lease, so the tenant will pay all taxes, insurance, utilities, and service costs related to their use and occupancy of the building. Finally, as is common in many leases of this type, there's a 9-month rent credit, and there will be a tenant improvement allowance of $25 a square foot. When you add together the capital improvements and the broker's fees, it'll take about 18 months for the county to recoup our initial investment. After that time, the county will receive about $250,000 a month in rental income, which equals about $3 million a year. Mr. Byers, Mr. Thompson, and I are all available to answer any questions you may have.
Okay, if I might ask just a couple of questions. First off, I really appreciate you circulating the actual term sheet, because I thought that provided some extra detail about what we're doing. And I was very pleased to read that SoftBank will be guaranteeing this transaction. I haven't had a chance to do any research on Starburst. Could you speak a little bit about who Starburst is? I know they're guaranteed by SoftBank, but if you could tell us a little bit about Starburst.
Do you want to talk about due diligence? We have undertaken a due diligence process that Mr. Thompson will discuss.
Yeah, Starburst is a holding company, Starburst One Inc., because there's 3 Starburst companies, and they're a holding company, a subsidiary of SoftBank. They are the ones that are involved in the Sprint acquisition, and so the 3 Starburst companies all have some role in the Sprint acquisition. We are in the process of still completing our due diligence in terms of we've got a Dun & Bradstreet report. We've also got a litigation report. They're litigation free. They're based in Newton, Massachusetts. I think it's Newton, Massachusetts. And we've got some unaudited financials. We're in the process of getting the audited financials to satisfy our concerns. And as noted, they'll be guaranteed by SoftBank, which is one of the 3 largest companies in Japan. So,
yeah, I really appreciate you doing that diligence, but that SoftBank guarantee certainly makes it gives us great certainty. Do you have any sense for whether they might be interested in the second building at some point? Or maybe that's something that can't be discussed right now.
They have requested, and we are going to include in the lease that's currently under negotiation, a right of first refusal for the second building. So yes, they are interested, but I think it just depends upon the timing. The other aspect of that right of first refusal is the county retains the opportunity to temporarily occupy any floors of that building. Say we wanted to put in a conference center, doing something on a limited term basis. So we will have access to the building, and that won't trigger the right of first refusal. But we hope that SoftBank may in fact be interested in the other building over time.
Okay. Yeah, I'm hopeful that that will happen. I mean, in light of the big transaction they just did with Sprint. Over in Section 7 of the term sheet, there's a discussion about management fees are not going to exceed 3%. I just want to understand a little bit what those are, because I know we concurrently have approved an arrangement with Orchard Management that we're paying, I think $40,000 a month to Orchard Management.
Not right now, but we will be paying that once we do the improvements to the building that are outlined in that other agenda item.
And that's for, of course, the $40,000 is for both buildings, and according to the board member, that actually would probably go up when there's occupancy, if I read that right.
Yes, but the way that the rate that the lease is set up is a triple net lease, which means that all maintenance and operation costs will be paid by the tenant.
Right. So presumably they'll pay half of the Orchard fee since they have.
Right.
So I guess my question is, then what is this? Is this as a management fee shall not exceed 3%? Is that a different management fee?
That's the well, Lee, maybe you want to explain that, but my understanding is that that's the overhead essentially that we pay to Orchard for managing the property for us, and that 3% payment of that 3% is included in the lease with Starburst. So we're negotiating with Starburst, and it's their responsibility to pay that.
Yeah, I guess here's where I was going is just so I understood was if it's $20,000 that we're going to pass through to Starburst, that would be more than 3% of the base rent. So they must. Do you see where I'm going, Lee? I mean, we have this provision that says management fee.
The $20,000 includes both the 3% plus the operating costs like irrigation, utilities,
I see.
electricity.
Okay, thank you. All right. So yeah, so the hard costs, so to speak,
right,
are in that. So of that $20,000, only a very small amount is the quote.
That's
management
correct.
Fee. Okay. It was interesting to note that the tenant wants to put on a rooftop garden on the building. So I'd like to hear a little bit more about that.
We the way that we are setting up the lease, anything that is legal and that is approved by the local jurisdiction, which is the city of San Carlos, and there's one other criteria, Lee, that we would allow that. But we also retain the right to require the tenant to return anything that we don't approve of or that we don't want to continue to have at the building, to have them take that out and return the property to its original state or state that we're comfortable with at the end of the lease. And we can decide at any point in the lease process, either at the beginning or during the middle or at the end, how we want the tenant to how we want them, whether that we want to retain those improvements or whether we want them taken out and returned.
Yeah, I think that's consistent. We've looked at the rooftop garden in concept. We haven't seen any particular plans for it, and we're assuming it's more of a Zen type area, not a palm trees, etc. And the other, right now we know on the roof, for instance, they want to put an antenna, and so. But the garden is something that is kind of unique, and they wanted to know up front if we had any objections to it, and the answer was no, so long as the city of San Carlos will approve it in terms of their oversight of the building, we don't have an issue with it.
Okay. And then the last question I had was about the signage. How are we dealing with that electronic sign these days? Because there's, in section 12 of the document, it talks about signage, but I don't think that's the electronic sign.
No, the electronic sign still belongs to the city of San Carlos. It's not part of the building.
Okay, all right. So we don't, that's a moneymaker, I'm sure.
Although, just as a matter of fact, I think the motorization, et cetera, for the sign is they actually sublease some area, or lease some area in the other building. There's a little room in the other building that actually has the controls for that electronic sign.
That's correct.
Okay. Well, I appreciate you answering those questions. I had a suggestion. I just want to suggest to my colleagues. I would have some interest in actually seeing the lease documents. Obviously, this deal has to get signed in accordance with the time frame that the tenant requires, and for that reason, we can't wait 2 weeks. But it is a very substantial transaction when you think about the monies involved, and we. Typically have the contracts when we vote on matters. I mean, our old board books were very thick for that reason. So, given the need to need to get it done, an idea I had, again, wanted to suggest to my colleagues was, and particularly given, that I did a lot of these leases in my old day, I don't expect to have any great, insight or any big change, and it's not a question of not trusting the staff or the lawyers. But again, just given its magnitude, I wouldn't mind taking a look at it. And so I thought perhaps we could just have a subcommittee consisting of myself and one other board member who would just, provide any feedback within the time frame needed to make the deal occur.
Do you want to make a motion to that effect?
Yeah, again, I guess I would just want to get sure, I'll make a motion.
Just one quick, I guess, advisory comment. And this is just more of a practical comment. Obviously, any input would be involvement and participation by board members would be welcome. But just as a practical matter, the parties do hope and expect to have the lease fully negotiated and executed by the end of this week. I mean, that's the hope and expectation. So any participation by board members would need to happen this week, so you would need to, at least dedicate some time this week to that effort.
I wanted if I didn't emphasize that enough before, this deal needs to get signed within the timeline that the tenant requires. So there would be no risk to that timeline under this suggestion.
I guess my comment would be I don't have a problem with any of us that want to look at it between now and the end of the week. I guess my concern is if you want to make a change, maybe the rest of the board doesn't. I don't really want to micromanage the lease. I mean, this is a lot of money to us. We're not giving them the money, basically. I would like if we have some feedback, but I want to be very careful because if we want to change it, one person wants to change it, what about the rest of the board? I think, the fact that we've seen the sort of the points here of the counter proposal and have what's in here, to me is sufficient. I'm happy to look at it if like anybody else, but I want to be very careful that we don't start getting all these different comments and and the rest of the board doesn't necessarily know, and so we've got an issue here with the Brown Act because we can't talk to one another about it. So I'm fine with us looking at it if anybody wants to, but I think we need to leave the negotiations in the hands of our county manager. I mean, that's been the protocol, and I don't see anything here that's really out of line that would cause me to have heartburn. So I would say that's fine, but unless, in conjunction with the county manager, there's a change, I don't think we should change anything unless it's agreed upon by both parties and the county manager to be our negotiator or pay givers.
Again, it wasn't a suggestion to be a negotiator. Again, it's extremely rare for us not to have the full document when we vote. And, really not, we always have the full contracts. And I just feel, a duty to at least take a look over them. So, it's only for that reason.
No, and like I said, I don't have a problem. I just want us to be sensitive to turning this on its ear if we have such a short period of time. So I'm happy to look at it too, but I think we need to, I'm going to make a motion to move this forward, and then if any of the board members will give you feedback, if we can have a copy of it or a draft.
So there's a motion. Do I have a second?
We will, just one quick comment, we will make sure that, staff will make sure that we provide the latest and greatest copy of the lease. It's probably 97% complete for board member review.
Can I ask a question? What if someone sees something in the lease that really stands out as problematic and they give that feedback to you? Can there be a member's memo indicating that something is going to be changed based on some kind of input by a board member? I'm trying to figure out how we do this without
Yes, that's
hurting.
about why I thought maybe the subcommittee would be helpful, because you would avoid that problem. Just, you'd have two board members. Again, the chances of us making any changes are very small.
I mean, you've got here, what you have before you is the sort of the material terms, so the major parameters, material terms of a lease agreement. If something were to happen over the course of the next few days that would change a material term, we'd need to come back to the board for board approval.
You would, yeah.
Yes, we would.
Let me ask a question. I think Supervisor Pine made a motion first. He didn't get a second. And then there's a subsequent motion from Supervisor Tessier. What's your advice?
Well, if the first motion doesn't get a second, then it's not a, the motion fails,
second.
and then the next motion needs to be considered by the
I'll
board.
second Supervisor Pine's motion about the having a subcommittee.
But does that also approve what we have in front of us?
Yeah.
Okay.
Yes.
I wonder if I might make a suggestion.
Okay.
Supervisor Pine, why don't you meet with Mr. Byers this afternoon and Ms. Jensen and go over the lease and put your input and listen and have a conversation with them? I don't really think we need a subcommittee.
I will definitely, I plan to look at the documents and give them my feedback. I just wanted to make the suggestion to see if anyone else wanted to, formalize it more in that way. But if that's not the will of the board, I'll just give my feedback directly to.
I have one other question.
And we would welcome that feedback very much.
Can a subcommittee be one person?
That's probably not right. I don't think so.
Well, no, yes or no?
I mean, it's, I guess I have to look up the definition of committee in the dictionary. Can a committee be, does a committee by definition have to have more than one person? It's an interesting question. I think the answer is probably yes.
I don't want to, if I don't want to cause a split vote over something like of this nature. I'll go ahead and withdraw the motion, because I just personally think that, it's our practice to have contracts when we approve transactions. This transaction is amongst the most important, most sizable and most important that we see. I'm a little uncomfortable, not having a chance to look at contracts in depth. So I want to suggest this as a possible way to kind of get around to meet the need of the tenant, which is can't wait. My first preference would be, but we can't do this, is have the whole board see the contract, have the whole board vote with the contracts in hand. That'd be my strong preference, but that's not doable. And the last thing I want to do is slow this down. So I just wanted to make this suggestion as a possible different approach. But again, I don't want to have a split vote over some of this matter, so okay. I will just go ahead and provide my input directly.
So that motion is withdrawn. So Supervisor Tessier made a motion. Do we have a second?
Second.
Second. All in favor?
Aye.
Okay, that passes.
Now, I assume that includes A, B, and C. I'm assuming that would be my motion. It was approving A, B, and C, unless we need to take those separately.
We have to do those separately, Mr. Byers?
My motion was to approve 19A, B, and C, basically. I thought I should spell it out in case they have to be separate.
No, it's one resolution.
Okay, very good.
So, we're satisfied.
Okay.
Okay. We are now down to board members' reports.
No report, sir.
Supervisor White? Supervisor Slocum?
Thank you. I just wanted to share with you all that on Sunday, the North Fair Oaks Community Council and I had a planning retreat, a work plan retreat for us to focus on what work the council wanted to accomplish in 2013. It was very productive. I think everybody was very pleased with the outcomes. And just to share, their number one priority for 2013 on a democratic vote of the members was illegal dumping in North Fair Oaks. So appreciate the North Fair Oaks Community Council members taking time out of their Sunday to do this. It's certainly appreciated. And the second thing I would say is that just wanted to recognize Beverly Beasley Johnson for the hackathon that went on Saturday at Stanford University. I went there being sort of a geek to see what it was like, and Supervisor Pine was there, and we I think we're both impressed with the work that the Code for America Fellows did and that the people in attendance did. So compliments to her leadership for putting that all together, and the board's approving the Code for America contract. Thank you.
Supervisor Tessier?
Yes, I have two adjourned memories. The first one is for Elsie Martin Garrison. She is survived by her sons James, David, and Robert, and daughter-in-law Rose Garrison. Her family moved to California, and she attended Crocker Junior High School and Commerce High School in San Francisco. After growing up in Canada, she learned to be a pilot, and she learned to fish and hunt before she could even drive a car. She was the original soccer mom in Daly City in 1952, driving her Plymouth station wagon. Her civic leadership spanned over 60 years. She was president of the American Sports Women's Club, Friends of the Daly City Library, Daly City Garden Club, library commissioner, volunteer at the Dolger Senior Center with over 1,600 hours of service. She was also served on numerous committees throughout Daly City, including the Community Hospital Committee, which ultimately developed Seton Hospital. She covered the social scene for the Daly City Record as Diane Daly and has won many awards for her poetry and creative writing. She will be sorely missed by her family and the community. My second adjourned memory is for Robert Franceschini Sr. He was a beloved father, grandfather, business and community leader. He was not only generous, but he's also gregarious. He had great charm, a welcoming nature, and a smile that was legendary. He had a keen sense of style and always dressed to the nines. He would always come with seized candy and fine wines in his hand. He was born in Palo Alto, graduated from St. Joseph's Elementary School, Bellarmine College Preparatory, and Santa Clara University. He also attended Stanford Graduate School of Business. He was on the board of directors of Kainos Home and Training Center, president of the Sequoia Foundation, president Holbrook Palmer Park Foundation, president and co-founder of the Sequoia Awards, president of the Atherton Civic Interest League, president of St. Pius Men's Club, president of the YMCA of Redwood City. Boy, he was a busy guy. President of Redwood City Chamber of Commerce, which awarded him their Man of the Year in 1974. He was also president of the California Beer Wholesalers Association. He was a Bay Area beverage distributor and president of Coors West and Regal Beverage Company. He also co-founded Evergreen Savings and Loan. He was also an avid gardener, duck hunter, fisherman, and golfer. He is survived by his children Robin Budelli, Robert Franceschini Jr., and Richard Franceschini, and his many grandchildren. And our sympathies go out to his family.
Well, actually, two people to endure in memory of. Bob was a personal friend, and Elaine and I spent a lot of evenings with him at what used to be Fabros, is now John Bentley's. His wife Nadine passed away a few years back, and I remember when I went out to dinner with Bob. He said that as far as he was concerned, his life was over until he met Sylvia Nelson, and they had a great life together. He was a fabulous guy. Spent time with him not only at restaurants but also on a golf course. Wonderful man. He'll be greatly missed. I think I first met him when I was in the sheriff's department, and he had this Coors West, which is actually the site where we're building our new health clinic for North Fair Oaks. It's Redwood Junction. In any case, he was always a real dapper guy, and he always anything we needed to do, any kind of event that we had for kids, he always made sure he supplied us with anything we needed. He's just a wonderful man. The other person to adjourn in memory of is Tim Guiney. He was actually Timothy J. Guiney Jr. And it has this, fairly brief little obituary of Tim. He was the husband of the late Kay Bray Guiney, and he was the father of Michelle Fogarty, and his son-in-law Bill Fogarty. Bill is actually a sheriff's deputy, and Katie Guiney, and he actually had this cancer for a long period of time, and one of the things, he was a determined man, very determined man, and he was determined to live long enough to see the first birthday of his grandchild, Will, and he did, just by one day. I knew him since he was 19 years of age. When I was a Daly City police officer, he was 19, and he used to hang around with us, and he was, this guy had a great wit, and he was very witty. He just had you laughing constantly. In any case, I bought a car from him because he worked in a place called Wilson Jeep. And then later in life, when I transferred over to the sheriff's department about 1972, maybe 1973 or something like that, I ended up being hired in 1972 by the sheriff's department. Tim took the test at the same time, and he was not a physical guy. And we had, at the time, a really very difficult exam to be in the sheriff's department. Tim went to Brisbane PD, but the reason I went to the sheriff's department is because of what he told me about how great it was in the sheriff's office. So he worked as a reserve deputy for a couple of years, paid reserve deputy, then went to Brisbane, and he rose to the rank of sergeant in Brisbane, and then they hired him in Broadmoor as the chief of police, and he was there for 12 years. He did a phenomenal job. The guy was just a great ambassador. I think in his eulogy, one of his daughters said he was a great political mind. In fact, he did. He was a very smart guy, and he had not only that Irish wit, but he also had a great political sense as well. And it really benefited the Broadmoor Police District. So he was a friend, and he will be very greatly missed. Did you want to say anything, Adrian?
I did. Tim was the police chief in Broadmoor, and in the early days, sort of the 70s and 80s, between Daly City and the Broadmoor Police, it was like the Hatfields and the McCoys. But because of Tim, he was always there to protect his district and protect Broadmoor as a special district. But because he had such a great personality, he was very political, but he also had a great personality. He was really good with people, that slowly but surely that relationship between Daly City and Broadmoor actually coalesced, and we sort of left him alone after a while, but he was always grateful for that, and he was a great guy. He was a great chief up there, very well respected in the law enforcement ranks throughout our county, so he will be sorely missed.
Yeah. Last one is Martin Fox. That's okay.
Thank you again. Please adjourn in memory of Evan Quick, who died last Wednesday in Southern California, where we've had all too many deaths recently. He had been hospitalized for mental evaluation at least 2 times before his mother served him with a restraining order. He stole her car and seriously wounded 2 sheriff's deputies who have recovered. San Diego County Sheriff Bill Gore was quoted at the news conference he held as asking, "At what point do we have some kind of dialogue and common sense conversations about the violence we are having in our society?" And he concluded by saying, quote, "Mental health care has become the burden of law enforcement, and that's a gigantic mistake, and I think we're paying for it with the violence." Please provide the mentally ill who lack the insight needed to seek treatment voluntarily with the opportunity to lead productive lives, and treat them just like those who lack the insight needed to understand their need for treating their tuberculosis, and just like and the need to change their criminal behavior. Thank you.
Thank you, Marty. We'll now adjourn to closed session. So you We're back in session. Mr. Byers, can you report on the results of closed session?
Yes, gladly, Mr. President. The board on a 4-0 vote, Supervisor Slocum absent, took 2 actions. The first action the board took was to agree to join 20 other counties in seeking appellate review of a trial court decision that upheld an interpretation of state law that would continue requiring counties, as opposed to the state, to pay for ancillary services provided in institutes for mental disease, otherwise known as IMDs. The second action the board unanimously took was to agree to file an amicus curiae brief in support of Santa Clara County's defense of a lawsuit filed by the Silicon Valley Taxpayers Association, which in fact is challenging Santa Clara County's sales tax measure as unconstitutional. So the board agreed to support an effort to file a brief in support of Santa Clara County, and I thank you for that.
Thank you, Mr. Byers. Well, board will now adjourn.